Hey, good afternoon, everyone, and welcome to our special study session here on October 20th. We are joined by leaders here from the city and county and the Housing Authority, as well as our nonprofit partner, Destination Home, and I know many partners in the audience to talk about our collective efforts to address homelessness and the substantial work we have ahead. So thank you, everyone, for taking the time to get started here. We'll kick off with our city manager, Dave Sykes.
Thanks, Mayor. Really appreciate the council's time today. I don't think I need to tell the council the importance of this issue, and I think the hours that we have ahead of us today will be very helpful to kind of understand the issue in a little bit more detail. Obviously, beyond just the fact that we've got people in our community that have nowhere to live, and the importance of that, but also the fact that the impacts of homelessness affect more than just the people that are homeless. It's in our neighborhoods, it's affecting our businesses, it affects the environment, families and youth are involved, and so super important. It's also an issue that penetrates the whole city organization. So it's not just a housing department issue. Many of our departments are impacted by issues and need to rally to address those issues. And although the housing department is our point, I do view this as a citywide issue and an organizational-wide issue that we need to confront together. And ultimately, it is a community issue. And so it's really through working with our community that we're going to need to find some solutions. So I'm going to let Jackie start us off. And once again, thank you to the council for giving us this time.
Thank you, Dave. I'm Jackie Morales-Ferrand, and I'm the Director of Housing, and I'm joined today by Ray Branson, who's our Acting Deputy Director of Housing, Jennifer Loving, the Executive Director of Destination Home, Key Lee, who's the Director of the Office of Supportive Housing for the County of Santa Clara, Katherine Harass, who's the Executive Director of the Housing Authority, and Frenchie Rogers, who's a San Jose resident. Our collective vision is to end homelessness in Santa Clara County. This does not mean that no one else will ever experience a housing crisis again. The reality is that we'll continue to have economic recessions, unforeseen changes in someone's life, an unsafe or unwelcoming family environment which may create a situation where individuals, families, or youth could experience homelessness or put them at risk of being homeless. What ending homelessness means to us is that we will have a systemic response in place so that homelessness is prevented, or if someone becomes homeless, it is rare, brief, and non-recurring experience. In San Jose, we have declared a shelter crisis because we as a community are experiencing the tragedy of people living in our streets. Affordable housing is the solution. Housing is better than homelessness. It's better for men, women, children, families, neighborhoods, businesses, our downtown, and our creeks. And it's also better for our individual pocketbooks. Often, it is less expensive to house someone than to let them live on our streets. We have accepted the challenge to end homelessness because we can create safe, clean, impactful, healthy homes for residents with limited means and for residents who have special needs. The purpose of this study session is to provide the Council with a system-level overview of the coordinated regional response that is being implemented by the city and our partners. I did want to acknowledge today that we had a request to set aside some time specifically for homeless people and for advocates. But because this issue impacts so many different interests, we felt it was best to provide everyone time during public comment. Our goal today is that the City Council will have a better understanding of the entire toolbox of housing resources that we have developed across the region, including the specific housing strategies we are implementing, the coordinated assessment and referral system, and the outcomes that we are collectively tracking, and finally to provide you an overview of the challenges facing the city and opportunities and tools that are at our disposal. We will start the session on how we got here, because widespread homelessness is a relatively new phenomenon in the United States. 30 years ago, we didn't have this problem.
Good afternoon, Ray Branson, Acting Deputy Director at City of San Jose. So as Jackie mentioned, modern homelessness is a complex and challenging issue. While any one person's individual experience with homelessness is unique to them, and there is no exact way that someone becomes homeless, there are some key underlying factors. Well documented, the loss of redevelopment, the dissolution of redevelopment and the loss of affordable housing funding, coupled with wages and public assistance that have not kept pace with the cost of living, and then the closing of state psychiatric hospitals over the last 30 years have really contributed to a very, very challenging situation here in California. As I mentioned, the loss of affordable housing funding cannot be understated. Since 2008, housing funding in California has declined by 66%, over $1.7 billion a year. We're not keeping pace with the need of affordable housing by any measure. Our production levels in California should be at approximately $180,000 a year, 180,000 homes a year, and in 2015 there were less than 100,000 created. Across all income spectrums of extremely low income, very low income, and low income housing, we're simply falling behind the need, and it's a tremendous problem because, as you see, declining income and increasing cost of living are contributing to a widening gap. Simply put, renters are paying more than they used to for the rent in their homes, and they're making less. So we're seeing people fall into homelessness over and over again simply because they're living paycheck to paycheck and they're stretched so thin. On top of this is a serious issue unique to California and deinstitutionalization. California was ahead of the trend of deinstitutionalization, moving to bed and care facilities and nursing homes as early as the 1950s. But by the mid-70s, we'd closed half of our state hospitals. Agnew's, right here in San Jose in 1971, discharged 1,800 individuals to mental health facilities just in and around the downtown area. And by the 80s, the combination of the loss of all federal funding for these types of facilities, coupled with the inability to really actively work with people on the streets as a result of the LPS Act in the 70s, meant that there was no place for people to go and there wasn't adequate care and support for people who needed it the most. As a result, what we're seeing in California is a pronounced issue of homelessness. California, in the 2016 Annual Homeless Assessment Report, was home to 21% of the total homeless population in the United States. We also have the largest unsheltered population at 66% as a result of a combination of the weather and the climate and the vast number of people that we have coming here and the lack of affordable housing. Drilling down a bit more to the San Jose metropolitan area, which includes all of Santa Clara County, we can see the homeless point-in-time count for Santa Clara County was at about 6,500, which gave us the 7th largest point-in-time count in the country, the 3rd largest unsheltered homeless population in the country, the 5th largest number of veterans, and the 3rd largest number of chronically homeless. So in many ways, we have a serious crisis right here at home, a high number on a per capita basis of people that are living on our streets and in serious need of help. Drilling down even further into local numbers, we can see the 2017 homeless point-in-time count numbers, where despite good work going on in our community, we did see an overall increase in Santa Clara County by 13% in 2017, and an increase here in San Jose by 7%. Now, while in contrast to places like Morgan Hill that saw an over nearly 400% increase, and Gilroy, San Jose is doing very well, it still points to the fact that there's lots of people living on the streets and a need for long-term support. Our point-in-time count enumerated 4,350 people living on the streets over a 2-day period. 74% of that population was unsheltered, and a vast majority lived in encampment areas, along the streets, in abandoned buildings, and in cars and vehicles. The key subpopulations, the folks most in need of help, were the chronically homeless, still with over 1,205 individuals Veterans, still an area where we've been working. We have a smaller number of families and unaccompanied children, but we saw a tremendous spike in transition age youth 18 to 24, who are emancipating from the foster care system and in serious need of support. We see the causes of homelessness and the obstacles as things that are expected and align really with those root causes that we discussed earlier, but the inability to afford rent, underemployment or unemployment, bad credit, job loss, alcohol and drug abuse. But at the same time, we see people that are desperately wanting and searching for a place to call home, with 91% of the respondents in the 2017 survey saying they would accept an affordable housing resource if it was made available to them. And more than anything, we continue to see the need, with 70% of the survey respondents in the point-of-time count reporting a disabling physical or mental health condition. Folks dealing with drug and alcohol abuse, with psychiatric or emotional distress, with physical disabilities. So the need is as present as ever. The crisis is certainly clear, and now we need to think and talk more collaboratively about how we can work on the long-term solution. And I'll turn that over to Jennifer Loving.
Hi, Mayor and Council. My name is Jennifer Loving, and I'm with Destination Home, which is a public-private partnership that's been focused on solutions to homelessness since 2008. In 2008, elected officials from San Jose and the County of Santa Clara went through a Blue Ribbon Commission on shifting our community's focus from managing to ending homelessness, and the byproduct that was created out of that year-long effort was Destination Home. Destination Home's board has representatives from the public and private sector, as well as organizations that are working on the issue and persons with lived experience. Destination Home staff also is a mix of people with lived experience and people that have been doing this work for a long time. So the way that our board chose to focus on what it means really to make homelessness rare, brief, and non-recurring, and to have Santa Clara County focus on solutions to homelessness was by using a model called a collective impact model. Collective impact states that some problems that we have, or some crises that we have in our world or in our community, are too big for any one entity to solve, and are also not any particular entity's responsibility to solve. Homelessness falls into that category. So collective impact is pretty simple. It basically says that you have mutually reinforcing strategies and activities and goals. Those are funded jointly, and there is one shared way to measure the outcomes, and all of that is supported by a backbone organization that sort of demonstrates and proves the results. And the backbone organization in this model is Destination Home. An early example of collective impact is when we were working as a community when folks were living in the jungle, and also in some of the encampments around Tully and Center. And there was a big effort called Housing 1000, which was our first proof of concept, where we asked you to let us house 1,000 folks using a collective impact housing first model. Housing first basically says it doesn't matter how long folks have been outside. If we can connect them to housing and the services that they need to remain housed, we will have success. And an example of that was a couple that I met early on, Andy and Ernestine, who they'd been homeless for 20 years, and over the course of that time lost both legs, really frankly, to preventable conditions. And by the time we found them, there was a team of people. There were San Jose outreach workers and case managers. There were, the county had long-term housing subsidies that they had made available. There was a treatment team from Valley Medical Center, and it took all of those pieces together to triage and house this particular family, but then that has happened thousands of times since. This is an example of why it takes these different partnerships doing each of these different pieces of the work. And beyond the individual, obviously, what it means to individuals and families to not have to be homeless in our community anymore, We also learned how much we were spending managing homelessness. We did a very comprehensive cost of homelessness study in 2015 called Home Not Found. And that effort was done in partnership with the County of Santa Clara and an external firm who was able to help us understand how much we were spending managing homelessness every single year. And that was a 6-year study window, and we learned that we were spending over $500 million a year managing homelessness. Really, these are services and resources that folks that are experiencing homelessness were forced to consume or overconsume, hundreds and hundreds of visits to the emergency room, being arrested for things that were really nuisance charges and nothing else because they didn't have a place to go. Things that were really, again, preventable. Part of that cost study looked at a small cohort of people that had already been housed under that Housing 1000 campaign. And so we were able to understand very early on that it was much more affordable to our community to provide housing or supportive housing to people who need it. It wasn't just humane, but it was also made good fiscal sense. And I'm sure we will hear more about how that program has expanded over the years, but those were our early results. All of this has been captured under a community plan to end homelessness. Several hundred stakeholders came together a few years ago to create what is called the Community Plan to End Homelessness that has been endorsed by almost all of the cities in this county, as well as the Board of Supervisors, Water District, and other entities that have aligned around discrete strategies focusing on solving homelessness that have to do with the changes that need to happen at the system, at our system of care. The fact that we have a significant affordable housing crisis, and even when we build affordable housing, the attention that needs to be placed on building supportive and extremely low-income housing, if we want that housing to address persons experiencing homelessness, is so critical. And then what it really means to serve people with the types of resources and things that are customized to what people need. And so examples of that over the last few years have been the All the Way Home campaign to house homeless veterans. There's been almost over 800 veterans that have been housed through that countywide effort over the last few years. Over the last couple of years since the community plan was, when we launched the community plan until now, over 3,000 people have been permanently housed. The retention rate is very high for people that have been housed. People are being moved into supportive or ELI housing. They have services that they need, that they can engage with as they need to manage the transition and the recovery from homelessness. One of the other things that we've done just over the last year is really start to tackle rapid rehousing and homelessness prevention. So again, in partnership with the City of San Jose and the County of Santa Clara and the Housing Authority, how we are creating more rapid rehousing subsidies, which is different than permanent supportive housing. Rapid rehousing means that rents are subsidized for a shorter period of time, but it has to be matched with some sort of a living wage pathway. So we have worked to identify over 250 living wage pathways over the last year into good paying, or at least into living wage jobs. And then the other piece of our work has been around homelessness prevention. We kicked off a $3.5 million homelessness prevention system countywide in July, where each of the emergency assistance network agencies are using coordinated assessment to identify families that are really on the verge of falling into homelessness and have financial resources to do whatever needs to be done to mitigate that so that more families are not becoming homeless. I think with that, I will pass this over to Keely.
Good afternoon. My name is Key Lee. I'm the director of the county's Office of Supportive Housing. And we have the privilege and challenge of essentially managing, coordinating, refining and trying to improve the set of programs and housing services that we have collectively funded and implemented. This is a challenge that we take on happily every day. When we talk about the supportive housing system, we're really talking about a set of programs that are tailored to individuals' needs. As Ray mentioned, the causes of homelessness are complex, deep-rooted in the policy decisions at the state and federal level. And not all homeless individuals or families have the same barriers and challenges. And one of the key challenges for all of us as implementers of programs is to figure out who needs what and provide that type of service for them. For example, in our Home Not Found study, which took administrative records over a 6-year period, the Economic Roundtable analyzed all of those records and identified 104,000 individuals who experienced homelessness at any point in that time period. What they found was that 20% of the individuals were homeless for 1 month or less, another 32% only for 1 to 6 months, and another 12% 7 to 12 months. So overall, 64% of all of the individuals who experienced any type of homelessness in that 6-year period were homeless for 1 year or less. That's vastly different than the 1% of homeless persons who are homeless for all 72 months. So for us, it's figuring out what type of programs are needed and what individual needs what. Related to that, Jennifer mentioned the cost of homelessness. Individuals interact with our public safety net system in different ways. Overall, people are utilizing services at a cost of about $520 million a year. Those services are there to be used, and if people use them, get better, that is excellent. But what we found, like most managed care systems or any type of service system, that a small percentage of individuals utilize a disproportionate share of the services and sometimes don't get better. The cost study found that 5% of all homeless individuals accounted for 42% of the cost or the utilization. So one of our key challenges is to have a common set of tools and processes to understand the need of individuals with whom we come into contact with. And when it comes to housing supports, the key question is what is the duration and intensity of housing assistance and services in order to end that person's or family's homelessness permanently. Then, of course, making sure that we have the right programs in place in sufficient quantities and to determine if they're effective and how do we continuously improve them. So on the left, we have the main set of programs that Jennifer described briefly. And really that's permanent supportive housing, deep permanent subsidies with ongoing services, mainly for individuals and heads of households with disabling conditions, rapid rehousing or transition in place programs, mainly for individuals who experience homelessness but need temporary assistance, temporary services, and then with earned income and other income sources can maintain their housing without ongoing supports. Of course, we want to prevent all incidents of homelessness, and then we have transitional housing programs for people who need a little more structure and then can move on. One example that I would like to raise, just to kind of make it more clear about how this works, is take our success with the All the Way Home campaign. Here, we're housing homeless veterans. I think currently we've housed 800 veterans over the last 20 months or so. Homeless individuals are not walking around with a sticker that says, I'm a homeless veteran. And so we have to go and engage individuals, understand if they've served in the military, what that service was, and determine the type of program that was needed. Some homeless veterans need permanent supportive housing programs, and HUD-VASH is one of those ways that we provide that service. A lot of veterans need rapid rehousing, and we have federal programs called SSVF. We have county programs that provide that as well. So you can see what we're trying to do is identify the individuals and provide them and connect them to the right level of service. And to support all of those programs, we have a supportive housing system. The county is the implementer of the Homeless Management Information System. That's the data collection system for all of our programs. We manage the coordinated entry system, which is a common set of tools to identify needs and prioritize services. We also set and manage all of the performance standards for homeless programs. And underpinning all of that is the HUD Continuum of Care program, formerly known as the McKinney-Vento Act. HUD provides the county and other communities with funding for homeless services. In the county, communities and the county, organizations and the county receive a total of about $21 million annually for homeless services. And with that comes all of these standards and expectations about a coordinated entry system, a management information system. When we started building this supportive housing system, the communities in the county were only receiving about $12 million. And so we've really expanded the funding from the federal government since then. And finally, I'll say that while we have made a lot of progress, we've made a lot of progress in a really short period of time. The Office of Supportive Housing, which is here as the HMIS lead, the collaborative applicant, et cetera, was only established in 2014. Our coordinated entry system is only got off the ground since 2016, and our new homeless management information system was only got off the ground in 2015. So all of this is relatively new. This slide shows our investments in permanent supportive housing and rapid rehousing over the last few years. I think some of the colors are cut off there, but basically you can see that we're making huge investments. A lot of it is in permanent supportive housing, and a major contributor to that is the use of Section 8 and HUD-VASH for permanent supportive housing. We are also, as you can see, we're making investments in all program areas. And permanent supportive housing, I think you'll see why it's significant, of course, is because the subsidies are deep and permanent. These are programs, if they work perfectly, individuals stay housed and remain housed. In order to serve more individuals, you need to add to the capacity of the whole system. We also track our exits into permanent housing destinations. As you can see, as a system, only about 31% of all the people who interact with all of the programs that we have are exiting to permanent housing. The good news, that's the bad news. The good news is that permanent housing programs or housing programs seem to be more effective than emergency shelter overall. And, as we're rolling out the coordinated entry system, you may look at, wow, emergency shelter, poor outcomes. But the coordinated entry system hasn't really moved on to the emergency shelter system. That is to say that individuals who might have needed a little bit of assistance, say if they would have been only homeless for about a month, those are the individuals who we would try to move towards emergency shelter. This slide is trying to show that we're trying to track the non-recurring part of the supportive housing system, and we're looking at returns to homelessness after housing 6 months, 1 year, and 2 years. I think overall the number is really low, and as you can see, the permanent housing programs have essentially less recidivism or returns to homelessness than the temporary housing programs. Of course, we are also tracking the number of housing placements as a system by month and by program type. I will say that steadily we are increasing the number of housing placements, but it is nowhere near keeping up with the demand. For example, in our All the Way Home campaign, we are up to about 35 placements per month, but we have an inflow of about 24 and a backlog of about 400 individuals. So it just takes a lot of work to get the housing placements up. Just cumulative numbers over the last 12 months. So the line going up is good. And then underpinning all of this is something we call the coordinated entry or coordinated assessment system. And this is a little bit of a complicated chart. But essentially, we work with all of our access points, shelters, homeless outreach teams, to have them, when they come into contact with individuals, assess them using a common tool. That tool we call the Vulnerability Index Survey Data and Assessment Triage Tool. We enter that information into the Homeless Management Information System. The staff in the Office of Supportive Housing see all those registrants. Those registrants are then filtered or categorized by acuity level. Individuals and families at the high acuity level are put into the queue for permanent supportive housing, mid acuity for rapid rehousing or temporary subsidies and services, and the lowest acuity are directed to diversion programs or provided one-time assistance. Then individuals in the Office of Supportive Housing manage the capacity, all the different programs and services that are out there, and then we make referrals to available programs. This is our current registry, registry as of June 30th of 2017. As you can see, a little more than half of the individuals and households really need this temporary housing program. And for the, I guess, last 18 months that we've been implementing the coordinated entry system, the stratification, the breakdown of the different acuity levels has been pretty constant. I will say one more thing about the referral system, and that is typically individuals think that we're making referrals directly into a housing program. And in fact, what we're doing is we're referring them into a type of service. And the first thing that is done is that service provider, that case manager, is engaging the individual in services, and that the county is managing the pool of housing programs and making the referrals into a housing subsidy or a housing unit. Permanent supportive housing investments over the last several years. As you see, that's growing. The city of San Jose is contributing a little over $1 million to provide supportive services. Other cities are also contributing, Palo Alto, city of Santa Clara, city of Mountain View. And over time, we've been able to significantly grow our permanent supportive housing system. When we started working on this in 2012, we had the capacity to serve about 80 chronically homeless individuals. Now, as you can see, we have the capacity to serve about 1,300 or more than 1,300, and then, of course, HUD-VASH is separate. Since that time, we've added innovative programs like Project Welcome Home, which is California's first pay-for-success program. It's basically performance-based contracting using social impact financing, shifting the risk from the county, the payer, to private industry, and then the county paying if success is achieved. As part of Project Welcome Home, we have a pretty sophisticated randomized controlled trial study underway, and I think we have one of the most innovative management information systems. We call it SLATE or Continuum, and that is bringing together all of the administrative data on the clients of Project Welcome Home on a daily basis to help case managers implement their program. And now we're going to roll it out to the other 1,300 case management slots. Generally, permanent supportive housing for even for individuals with the greatest need works. About 84% of individuals retain their housing for 12 months or more. We also look at their ability to have income of $850 or more. That's roughly essentially saying that we're going to try to get everyone on supplemental security income. That number is inching higher, but not as high as we want it to be. And of course, it takes a long time to house individuals. Only 38% of the individuals are being housed within 90 days. On average, as a whole, I think it's taken 152 days to house someone from enrollment in the program to actually finding a unit for them to rent. And as Jennifer indicated, permanent supportive housing works. This is a chart that shows the utilization of services and shelter for Project Welcome Home clients prior to being housed and then after being housed. The 0, of course, is the date in which they were housed. As you can see, there's a precipitous drop in utilization of Valley Medical Center, the hospital, emergency room, emergency psych, acute psych, et cetera. Rapid rehousing programs. We've been focused mainly on permanent supportive housing programs, but now with the city and other cities, we are trying to expand our rapid rehousing programs. We're increasing that. Rapid rehousing programs are similar to permanent supportive housing programs in the sense that we are trying to house individuals. They have a lease, they pay rent, they have to abide by the rules of that apartment or that development. The key difference is that in the rapid rehousing programs, again, is at some point the individuals have to pay the full rent and take over the full rent and pay that on their own. And this shows the capacity of all of our rapid rehousing programs as of a couple months ago. And as you can see, we are slowly inching towards the utilization of all of the programs. It just takes a long time to implement. For example, in fiscal 17, the county set aside $1 million for a rapid rehousing for homeless families with children, targeting and working with the school districts. We had to select a service provider, conduct an RFP, put them under contract. They had to hire individuals, and now only in just this past summer is it really getting off the ground. This is a chart showing the utilization of rapid housing programs in the first quarter. And I want to make a note here. This chart is showing the income of rapid rehousing households or households participating in rapid rehousing programs once they enter the program and once they exit the program. The green line shows what is the affordability level. I'm sorry, the green line is what is the 30% AMI level. So households earning, a one-person household, for example, earning $25,000 or less is considered extremely low income. What we see is that even though households enter the program and exit the program with higher income, they're still extremely low income. And therefore, in order for our rapid rehousing programs to work, we need to increase the supply of apartments, units that are affordable to extremely low-income households. This chart is about our homelessness prevention programs, and I'll just touch on it briefly. We are just beginning to look at our homelessness prevention system. For many years, it was operated by a small network of agencies that kind of operated independently. You would go to one agency based on the zip code that you lived, and if they had funding available, they would try to provide the emergency financial assistance for you to prevent your homelessness, pay some back rent. Oftentimes, they could only pay a portion of that amount, and there was no common assessment tool. There was no way to determine if the housing assistance that was provided actually prevented that homelessness, or if not for that housing assistance, that individual or that household would have become homeless. And so the city and the county and Destination Home are working really hard over the next 3 years to implement a new homelessness prevention system. And of course, we do have a range of temporary housing programs, and this is our current capacity. And we've been growing that over several years. Now, what you'll see is that we basically, at the peak of the cold weather season, we can temporarily house about 2,600 individuals. On any given night, there are 7,400 individuals who are homeless. I'll note here that there are basically no funding sources at the federal and state level now for emergency shelter and transitional housing programs. That is almost all locally funded. And the supportive housing system that we have, though, is really reliant on what we call tenant-based rental assistance. Subsidies, money that we can provide to individuals, but they have to go into the community with assistance to find a unit to rent. We are not going to improve our system, help more people, unless we really implement and increase our housing inventory. And for the county and for others, I think it's important to note that what we need to do is try to increase the supply of housing at all income levels, but of course at income levels that are affordable to the lowest income individuals in our community, especially those with disabling conditions. I think generally we have seen that the affordable housing crisis has disproportionately affected lower income households. I think in the last RHNA cycle, Santa Clara County, all the jurisdictions in Santa Clara County, met about 75% of their RHNA production goals, regional housing needs assessments, housing targets based on projected growth. That was excellent. But if you look at the housing production or the permits issued by income level, you'll see that we exceeded our goal. We met 139% of our collective goal for households earning over 120% of area median income. And we did not meet even 30% of our goal for all other income levels. And so with the city council's support, with the support of every city in this community and with all of you, we were able to pass the 2016 Measure A housing bond, $950 million for the basically development of apartments mostly. And for the county, our focus is trying to focus and target those resources on supportive housing and ELI housing. And we know that we have not in the past produced sufficient numbers of housing overall, but much less supportive housing. This is a chart that is intended to show the paucity of supportive housing developments and units countywide. The good news is that even before Measure A, we did have some significant developments in the city of San Jose. So we had 9 developments, 136 units, and even before Measure A, we were able to work with Jackie and her team and the city council to get going 8 new developments totaling 544 units. 3 of these developments are 100% permanent supportive housing developments, and we are looking forward to implementing and coordinating all of the services that are there. With that, I will pause.
Thank you, Keith. So we're going to move into some more city-specific challenges created by the impacts of homelessness. But before we do so, we wanted to take a moment to let Frenchie Rogers speak. Frenchie's a San Jose resident who would like to share her experience kind of interacting with the systems and numbers that Keith just talked about and how it has gotten her to this point in her life. So I'd like to turn it over to Frenchie now.
Hello. First of all, I want to thank the City Council for their prayers. I came through surgery great. Up until about 2.5 years ago, I had a home. I had 3 jobs. I was a caregiver for terminally ill. My ex-mother-in-law called, said she needed me because she's having open heart surgery. So I gave up everything, found a caregiver for my clients, and moved up to Dublin. After 6 months, my mother-in-law said she didn't need me anymore and that I had to go. Well, I didn't know the area. I didn't know where to go. I packed my bag and I left. I ended up in a shelter in Fremont. I stayed there for 3 days, and then a woman I met there said, well, we can get something in San Jose. So I moved to San Jose. Well, she got a job and she moved on, and me, I didn't. I stayed in the jungle, which no human being should ever have to stay down there. I was raped. Thank God there's emergency numbers for women who are in need, and I was one of them. About 1.5 years ago, 2 years, I met Megan Collar, the director of PATH. And through hard work and numerous phone calls, writing in blue ink because black don't fax, and I finally got an apartment. It's a brand new apartment, and anybody can work work, they have to really want to have to get off the streets. And PATH is the way, I truly believe. And if the city council needs any help with fundraising, I'm the one to call. Thank you.
So homelessness, without question, creates the biggest impacts for the people that are living on the streets and the struggles that they experience on a daily basis. But as a city, we see a variety of other challenges in the community, in the environment, and most tragically, the health and human impact. To give you a few examples of the impacts that we see and our responses to them, I'd like to first start with community impact. We see in St. James Park, the Tully ball fields and parks throughout our community, individuals, philanthropic individuals wanting to give and wanting to help people on the streets, giving out food, giving out clothing, giving out goods to help people with the struggle of everyday life. While this is a commendable activity, we do see an impact in the use of the parks, and the loss of parks is a resource for everyone in an open space. We also see the lack of connection with services and with supports and with long-term help that can help people get off the streets. So right now in St. James, we're piloting an education and redirection strategy. What we're trying to do is ensure that those in need know where to find food. In the case of St. James, we're even going a little farther, and because of our work with the advocates and with the homeless community, we've identified a resource gap in the downtown area. So we're beginning to look at other opportunities where we could increase food resources for those in needs in safe, healthy, stable places where they can be connected to other services. We're working to provide information on volunteer opportunities, the people who are coming to feed, so that they can get connected with food resources, but also help with the long-term goal of getting people off the streets and into housing. And then we're educating the public on the issues created potentially by this food and good distribution and the need to connect with other more reliable forms of support and service to make sure that everyone's good intentions are working towards this longer goal of creating stability. This pilot will be rolled out over the course of the next year, and if you go to St. James, you can see signs like this posted, and there'll be more work coming to council in the following months about how we're trying to educate and redirect and create a better solution for everyone. Similarly, we see environmental impact and encampments along our waterways. In 2014, the Regional Water Quality Control Board of the state determined a nexus in between pollution created from encampments and direct discharge. Essentially, what the state said is that encampments are now an identified polluter and part of our stormwater permitting process. So now we have an environmental regulatory body acting as a driver and making comments on a condition that is really created by a lack of housing. What we know is that we need to address encampments in the long term. We need housing, we need support, we need stability. So outreach is always going and has continued. But we've also started to look through our direct discharge program as the first of the state, working with ESD, PRNS, PD, and the Water District, targeting specific areas along our creek and seeing if we can have a measurable reduction in the pollution and direct discharge into the waterways through a targeted approach, acknowledging that the thousands of people living on the streets can't be, continuous displacement is not a positive strategy and won't have long-term results. But if we can show measurable reduction through a combination of outreach, abatement, restoration, and prevention and activation, then in the long term we might be able to work towards a better solution where there's less destruction of the environment and impact. I think finally, and I appreciate Ms. Rogers for coming and speaking today, but the health and human impact is the most severe. Right now in California, there's the largest hepatitis A outbreak in modern history. It's taken the lives of 19 individuals living on the streets and hospitalized more than 500 people in San Diego, Los Angeles, and now Santa Cruz County. It's a direct result of people living on the streets, eating off the streets, and being in unsafe and unsanitary conditions. Here in our community, we've seen a 164% increase in people dying on the streets of a variety of causes from 2011 to 2016, and the largest number of people dying on the streets last year. So it's clear that we need to have a more immediate response, and we have essential services programs like outreach, basic needs support like funding groups like Dignity on Wheels to provide mobile hygiene, and then opening up our libraries and our community centers as inclement weather centers during the coldest and wettest months of the year. This, however, still leaves the question of this immediate crisis and what are we doing now? And communities, especially on the West Coast, are addressing this in a number of different ways, from sanctioned encampments to tiny home villages to safe parking lots. However, the challenges with the immediate response are not dissimilar from the challenges that we face in siting any affordable housing development. Where are we going to put it? How are we going to talk to the community about this new program that we're implementing? And then, how will we fund it, given that our limited resources don't allow for these out-of-the-box type approaches? They're excellent questions, and they require more investigation, but they also provide opportunities as well.
Great, so we're going to wrap it up with our last thoughts on what kinds of opportunities exist, reviewing 4 different key areas. So first of all, our partnerships that we develop and build upon are critical. As you've just heard from one of our key partners, from the county, our ability to provide a strong partnership with the county has really resulted in our ability to produce more supportive housing in a coordinated fashion. But the other partner that's critical to our success has been the Housing Authority. Last year, for the first time ever, we released one RFP that awarded city capital dollars, county services and capital dollars, and Housing Authority vouchers. It was a one-stop shop across 3 public entities, something which is rarely seen. This month, the County of Santa Clara Board of County Supervisors directed their staff to study an alternative governance structure for the Housing Authority. The board of the Housing Authority is currently appointed by the county supervisors. We are working with Katherine and county staff to recommend a governance structure that provides representation for both the city and the county. And our continued ability to align our resources with the least disruption to our residents is critical in our ability to maintain and to continue to support permanent supportive housing developments in San Jose. Our ability to draft and create new ordinances that specifically address the needs of our unhoused residents is one of the areas that we have been trying to work on. The City Council recently passed the Temporary and Incidental Shelter Ordinance that allows faith-based communities to provide a safe and secure place while we build housing. And just recently, the Council prioritized the development of a safe parking program. So our ability to work on these different, more creative solutions is just one of the tools that we can use to address the short-term issues. We also continue to retain our authority regarding planning and land use. As the county begins to invest Measure A dollars in San Jose, it's important to recognize that we do retain this authority, and which will ensure that we have an ability to understand where the housing is being sited and to ensure it's sited in the right places. One opportunity we've been exploring is the addition of a planner that would be dedicated to 100% affordable housing developments as a way to expedite the planning process. And finally, with the passage of AB 1505, our inclusionary housing ordinance will allow us to require that a developer provide 15% of their new market rate housing as affordable. And though I doubt a developer would require 15% as homeless housing, because the inclusionary housing ordinance provides alternative options, including off-site and land dedication, we believe that this will provide us 2 new tools in our toolbox as a resource to providing more supportive housing. Lastly, I wanted to recognize the amount of investment that the city has made in supportive housing. Since 2016, the city has invested $45 million, and we will bring forward shortly another $12 million in affordable housing dollars investments. We have over 1,800 apartments in our pipeline, of which a little over 1,000 will be set aside for formerly homeless individuals. 62 housing opportunities are going to open up this year, and next year 258 apartments will become available. And here's a list of that pipeline. While I will acknowledge that we stumbled with the community engagement in our attempt to move faster with bridge housing communities, I don't want that experience to overshadow the success and commitment that this and previous councils have demonstrated. You've already approved 13 developments that contain apartments for formerly homeless individuals. And while we are just beginning on this journey, we know that we have much more siting to do and much more housing to build. Destination Home, with many community partners, including the county and the city, the housing authority, are working on a communication and education plan to create housing-ready communities. But ultimately, it is your vote of support that will make the difference. And with that, before I open it back up to you all for questions, I did want to just acknowledge that the staff of the homeless team is here today watching this. And you see Ray as the face of homelessness, but he has a small and mighty team behind him. And I just wanted them to quickly stand so that people know who you are that are working every day on this issue. And with that, I will open it up to
Jackie, thank you. I want to thank all of you for being here. I think there's been a spirit of collaboration on this issue in the last several years that frankly we haven't had on many issues. And it's, I hope it's a model for what we can do in other ways throughout our region. But I'm just very grateful for the people, because I know it really has to do with people being in the right places. I appreciate all your work here over at the county, and certainly Katherine over at the Housing Authority and Jennifer at Destination Home really helping us, and Jackie leading us here at the city. It has been that spirit of collaboration that has helped us get this far. We know we have an enormous amount of work to do, but I talked to a lot of mayors in a lot of other cities, particularly here in California, but I was just on the phone with someone, Mayor of Portland, and everybody is struggling with this in a huge way. Nobody's figured this out. Although we like to point to other cities and say, let's follow that model. We know they've figured it all out. Nobody's figured this out. It is far bigger than any one city can handle. And I look at the progress that's being made here in our collaboration, and I think we have a lot to be proud of, as much as we know there is an enormous amount of work that needs to be done, particularly that very harrowing statistic we heard, I believe from you, Ray, about the number of deaths that have increased over the last 5 years. That gives us ample motivation to push on. Frenchie, I wanted to thank you for your courage in sharing your journey, a very, very difficult journey. I'm glad that it ended with you being permanently housed and now reaching out to see how you can help others. So thank you very much for being here and for your, thank you. We have several members of the community who like to speak. Let's go to public comment, and then we'll come back. I know we have a lot of questions from council. So Sparky Harlan, followed by Gil Osmer, followed by Lynette Quiroz, Jackie Hefner, and Bruce Roberts.
Good afternoon, Sparky Harlan, CEO, Bill Wilson Center. I'm glad to see you having a study session on what you can do and what we're working on for homeless in our community. I've been working with Keely, Ray, Jan for many, many years, but the issue of homelessness among youth and families is slightly different. And I hope I have an opportunity to talk to you later, maybe in a study session, specifically around the count we released a couple weeks ago on counting youth in high schools, couch surfing, and community colleges. And it also really parallels what happens with families that are double, tripled up, that sort of invisible homeless population that we haven't really reached and identified. And when you talk about prevention of homeless services, yes, your emergency assistance network giving money to families is one piece. But when you talk about preventing youth homelessness, it's making sure kids can go home and stay home. So the idea is, in the old days, the Runaway and Homeless Youth Act passed in 1974 was about runaways going to the Haight-Ashbury and needing services to get back home and stay home. We need to remember that's how we serve and treat young people. It's not permanent housing. I was talking to Usage last week, the United States Interagency Council, and they said the outcome was permanent housing for young people. And I said it's permanent housing for the families, because 20% of our homeless youth come from homeless families. But for youth, it's getting back home or getting to safe, stable housing. So I know I've got 17 seconds. I would need more to get into this conversation about youth, but I hope we can have that conversation, because I think through the Gang Prevention Task Force and other services, we can take a slightly different take on this and help end youth and family homelessness.
Thank you, Sparky. Thank you for all your work. Welcome, Gail.
Thank you. Good afternoon. Over the last few years, we have seen a gap, a large gap, in services to the unhoused, and their needs are not being met in many levels. Number one, homeless people, unhoused people need a better access to case management. Most of them have to meet their case manager on the streets, so that's not a really good thing to do. Number two, since most and all programs for day services, especially at Little Orchard, have been closed, or Montgomery Street, the women's shelter for, it's not called Envision, but down, I can't think of the name, I'm sorry, services have been closed. They need to be reopened. They need to reopen these day services for the homeless. Winter is upon us. Where are they going to go during the day when they're kicked out of the shelters at 8 o'clock? Warming centers, my pet peeve, needs to be open longer, not just 31 days like it was last year. Winter is here. You're spending $14 million for 17-18 homeless services and subsidies. I sure would like to see where this money is going and how effective it will be. My last thing is, where are the underutilized motels? That's what they say they have. They're trying to open or buy. Let's buy some hotels on Monterey Road. Let's finally get the plaza open. What about Evans Lane? What's going on with that? So winter is here. We need to get homeless in someplace, not tomorrow, not in a week, but today. And let's open these warming centers and not wait till December, like I've been told that they're supposed to come back to council. Thank you.
Thank you. Welcome.
My name is Lynette Quiroz. I'm currently homeless. I'm here because I'm just tired of the unfair treatment that they give us when we are out in our area. We get swept and they don't care about the way they treat us. I guess it's certain companies that come out and they throw our stuff away. And yeah, we'd rather not be homeless, but since we are, we need to be treated, I think, like human beings rather than just like animals. They're rude when they come out and they get rid of our stuff and throw it away. They say it's contaminated, but it's our stuff, you know what I mean? And that's all we have left. I just wanted to talk about how unfair that they are when they come and throw our stuff away, and then we have nothing again. That's it.
Thank you. Thank you, Lynette. Welcome, Jackie. After Jackie is Bruce Roberts, and then a series of folks from the network, Karen Gillette, followed by Gabriela Gabrain, Ron Johnson, and several others. I'll call you in sequence. Okay. Hi, Jackie.
Good afternoon, everyone. First of all, I want to thank you for having the study session, which I think is incredibly important right now. Like many of you, on my way here, as I drove over Blossom Hill, the over ramp to 85, I saw on the sidewalk someone who had overnight or a couple of days ago built a house. That's where they were living. I saw the remnants of other people whose homes last night in the rain were destroyed. We all see this every day. But you know what the sad thing is? We're getting numb to it because it's becoming commonplace. We live in the richest area, not just in the nation, but in the world. We are the most innovative area, not just in the nation, but in the world. There is no reason that we cannot bring dignity to the people in our community who need it most. And we need to work with our communities and solicit from them the ideas and the cooperation so that together we can come up with solutions for people. These aren't numbers, they aren't statistics. They are the people who live in our community, and they deserve the attention. And I appreciate, again, having the study session open, and I hope and pray that together we can work and resolve this issue.
Thank you, Jackie. Is Bruce Roberts? Oh, there's Bruce. Thank you, Bruce.
Can you hear me? Okay. I would like to thank Ray and Jackie for recognizing the danger of outbreaks, such as hepatitis. I don't think this is going to go away. There are going to be more outbreaks. There's going to be flu. And I have an article by the New York Times Magazine about the danger of an unvaccinated population. No one really is in favor of of sanctioned encampments as a permanent solution, but I think like what happened in San Diego, the issue is going to be forced on us whether we like it or not. I mean, no one likes earthquakes, no one likes flooding, but these things happen. Thank you.
Thank you, Bruce. Karen? Karen, I know you're the first of several speakers that like to speak in sequence. Is that right?
That's right.
Okay, so let me just call everybody down. So I think you're all standing there, I'm guessing, so you know your order. But I just have Karen followed by Gabriella, followed by Ron, Jim, Ricardo, Phil, Ingrid, I think I see you all there, and Robert. Is that right? Okay. Got it.
Ready?
Thank you.
Okay, thank you. My name is Karen Gillette, and the following 8 speakers represent the network of advocates for the homeless. We hope that at some point in the future, advocates and homeless will be represented as equal partners in this homeless study process, rather than separate. On behalf of our group, I would like to thank you for this opportunity to speak, to provide additional perspectives on this complex topic. For those of us who work with homeless every day, we know that there is not any one solution to their varied needs. Research shows that using data-driven solutions is the most effective approach. The relevant data we have, which I think you've seen this afternoon, are the 2015 and 2017 homeless census and survey and the coroner's report on homeless deaths. From these, we can clearly see where our focus should be. The census and survey for 2015 breaks out the numbers of individuals living in their vehicles, almost 400 then here in San Jose. Why, you may ask, would I like to focus in on this element of our population? I can tell you when a person or a family is first homeless, they generally end up living in a vehicle. So more often than not, they are working poor who should be able to be rehoused in a short order. And if they're provided a safe place and case management services, that can happen. Now, the 2017 census and survey here in San Jose tells us that the total number of homeless is up from 2015. And in 2015, there were 31% of homeless who were sheltered, and now we're down to 26% who are sheltered, if you look at those numbers. 100% of our unaccompanied children in San Jose are unsheltered. 95% of our transitional age youth are unsheltered. Those are youth from 18 to 24 years old. According to the
Thank you, Karen.
Okay. Thank you.
Welcome.
Good afternoon. My name is Gabriana. I have been homeless over decades in different periods of my life. I am successfully housed through supportive services for several years, and I'm grateful. According to the Santa Clara County Coroner's report from 2011 to 2016, homeless deaths have increased 164%. This study identified an increase in deaths among the 65 years and older. Also points out that the supportive relationship between homeless and their peers, as well as other relationships they have developed, should maintain for their health. Finally, it seems more appropriate, that should be at the end, for us to consider the definition of emergency from Webster Dictionary. An unforeseen combination of circumstances or the resulting state that calls for immediate action, an urgent need for assistance or relief. As I mentioned, the harms and the scars and deterioration is lasting, and so connection on individual basis. Social service workers need to also ask the recipient what their needs are, like the access to individual response. So ladies and gentlemen, we have an emergency on our hands, a housing an emergency, a human emergency. Act now. All these plans sounds wonderful, but each day, each week, there's a scar that may never heal. So let's find solution now. Thank you.
Thank you. Welcome, Ron.
My name is Ron Johnson. I'm speaking on behalf of the Network of Advocates for the Homeless. And I'm speaking about the bullet point number 4, discussion of challenges that the unhoused face. I'll speak about 2 in particular. 1, services for the unhoused are not comprehensive, and they're not in sufficient quantity to meet the need or readily available. For example, there are not enough shelter beds in the county or in the city, and the waiting lines are growing longer. Subpopulations have little or few or no shelter facilities that take them. We saw a few weeks ago here a young couple with about to give birth to their child, and there were no shelters who were prepared to deal with them at that time. People who need mental or recovery programs must call in daily within a narrow time window to stay active on the waiting list that sometimes takes months. Second point, the lack of access to services is also a critical challenge for the unsheltered. For example, case managers often cannot find clients who are living in unsanctioned camps. Frequent sweeps of these camps is one of the main reasons for this problem. Clients cannot readily meet with case managers because many case managers do not have space in their offices for the type of discussion that's required, forcing the patients and the caseworkers to meet out in public. When a case manager does locate a client who lives in the streets, the connection only lasts until the next camp sweep displaces the client. That cycle repeats and repeats. Clients and families who live in their cars and must move constantly to avoid harassment. Often the vehicle is towed due to restricted parking and client service stability is compromised.
Thank you, Ron.
So this is an emergency. Thank you for your.
Thank you. Reverend Jamor.
I'm Pastor Jim, and I'm also representing the network, District 6. Thank you for your time. I'm addressing the challenges. We need some reliable measurement tools, feedback loops, surveys to gauge our successes and recalibrate. We need to reevaluate the community plan to end homelessness and make changes or add tools that work. Our staff time and resources and capacity is limited. We need to look at partnerships with private groups, CBOs, such as the Winterfaith Collaborative, Gang Task Force, and other programs. We have this happening in Santa Barbara and San Diego to supplement the capacity of the staff. We need more. We need financial resources to fill the service gaps. Recent large donations from corporations such as Google and Facebook given to Destination Home could easily be replicated in this interim solution to supplement the needs. Lastly, the interim emergency solutions have no home. The current city strategy, 1, permanent supportive housing, 2, rapid rehousing, 3, prevention, completely ignore the urgent needs of sanitation, such as bathrooms, trash pickup, supplies, cover from the elements, storage, mail service, foot care, and other basic human needs. The city's closing of Georgia Travis Drop-In Center for Women, Grace Community Center, and Little Orchard Shelter Drop-In Center program has cut off hundreds of people from services that they need every day. Basic services such as food, rest, and sanitation, and the dignity that comes with being clean and healthy. And the newly mobile-only outreach, while commendable, is not enough to fill the gaps. These challenges can be met through the eyes of compassion, but not through the eyes of cost. Thank you.
Thank you. Mr. Lopez?
Good afternoon. My name is Ricardo Lopez. I'm
Sir, could you
here
pour
to
the
speak
microphone
on
down a bit?
I'm
Thank
sorry?
you. That's
Can you hear me?
perfect. Yeah.
Yeah. Good afternoon. My name is Ricardo Lopez, and I'm speaking on behalf of the Homeless Advocacy Network. Temporary interim sheltering are needed now. Floods, fires, and health epidemics, including likely hepatitis outbreaks moving north from LA, combine to create more people without the access to housing right now in search of shelter. Number 1, working with people. 2, family and cars. 3, RV housing with nowhere to park. 4, LGBT, elderly, pregnant women needed dedicated shelters. 5, medical respite beds. 6, special equipment aided beds. The second challenge I pose is a commitment to act. Emergency declaration gives the power and imperative to act now, admitting that we as a city do not have the resources and need help. Priority setting sets up fights between competing needs and departments. It's the county's job to keep people healthy and provide basic services. We have a county-wide plan and don't need our own. Resources spent on emergency temporary solutions to keep people alive and healthy take away from housing's first model. Invest in long-term immediate needs. Thank you.
Thank you, sir. Welcome, Phil.
Good afternoon. Thank you, Mayor, and thank you, Council, for this session. And I want to especially thank Jackie, Ray in the Housing Department, especially James, who's doing a lot of work right now. We love to have having those meetings and being cooperative with us. Being part of those meetings. I wanted to say that we're trying to pattern this presentation after the presentation that you have made, Jackie, and so we have now opportunities that we're proposing, and one of those opportunities that we think are important is updating the community plan to end homelessness. It was several years ago it started, and we really do need to evaluate the outcomes so far, get feedback from the end users, and move forward and recalibrate it. You have, I hope, on your desks the copies of the Santa Rosa plan. Now, I know we're going to say Santa Rosa is a small town and it's not applicable to San Jose. The point here, however, is the process that they used. The city council created its own subcommittee, a committee of the whole council, and they met from their own 5-year plan. They met for 5 years to do this plan and just recently instituted it. You can see by the documentation they have a work plan subgroup. They have a plan in place. It has measurable outcomes. It has dates, and it has outcomes that they want to use with the bottom line to prevent homelessness wherever possible. This is a small city, but it has a great process. And we want to point out, as Jim said, there are 3 strategies underpinning Jackie's plan. One is well, he has the plan, but one is the prevention, one is the rapid housing, and one is the long-term housing. However, what is missing is in this plan, and we should note it. Bridge to housing addresses health and safety needs and emergency shelter strategies. We don't have that in our strategy. We need to put it in our strategy, and that's what we want to do with this. We urge you today, Mayor, please, let's have more of these study sessions. I think Sparky had it right. There's more to talk about. Can we have more of these? Do some more focused things with the whole group together. But let's include the end users. Let's include the advocates. Let's include the providers all together. And we appreciate everything that you're doing. And with the homeless emergency declaration that they have and we have, we can create the same work plan and same outcomes. Thank you.
Thank you. Ingrid, welcome.
Hello, I'm a homeless advocate. My name is Ingrid Granados. I'd like to present the idea of creating distributed multi-service center locations. We can use already existing service locations and supplement them with public and private locations to create daytime centers where people can receive access to both basic needs and referrals to other services as needed. Basic needs would look like bathrooms, showers, supplies, storage, mail services, foot care, among other things. Where could we have some of these centers? Well, we could use already existing emergency centers in the community and connect them with communities nearby to deliver reliable daily care with dignity to everyone. If an agency, for example, needs a kitchen, then a church down the street could help them with delivering food, or they could host it themselves. If a fitness center was able to partner up with a site, for example, they could provide showers at a discount or a low cost or no cost. We can use the network of small regional partnerships distributed across the city to serve the multi-purpose centers at extremely low cost. Some of the possible sites for these would be the already existing emergency assistance network. They have lots of locations here in San Jose, faith communities, assembly use sites, and community centers. It's important to remember that homelessness is an emergency now, that winter is approaching, and that something needs to be done aside from the proposed solutions that the city is already offering. People and families need help this winter. Thank you.
Thank you. After Mr. Aguirre will be Kathy Diltz, Alfonso, Deb Kramer, and Sean Cartwright.
Good morning. I'm Robert Aguirre. Thank you for letting me speak. We believe we need to enhance our interim housing options. Unhoused community members need a secure, sanitary, and safe place to live as they await permanent, affordable housing units to be built and occupy. There are options such as RV parks, safe car parks, tiny houses, and sanctioned tent encampments that have been proven to be successful across the country. They include trash collection, fresh water, restrooms, showers, Wi-Fi, and electricity, along with case management, drug and alcohol treatment, medical and mental health services. I just came back from a trip to Eugene and Portland, Oregon. Yeah, I went back again. I visited some well-established and newly formed legal encampments and tiny home villages. These two cities are representation of many cities across the country that are using creative methods that have been proven to be quite successful in addressing and solve the portion of the homeless housing problem. These methods are not intended on being a permanent solution, but rather an inexpensive and quick temporary solution. Whether these encampments use tents or hard surface units, they all provide the same shared services such as restrooms, kitchen spaces, clean water, meeting spaces, and places for social services to be delivered. There's no difference in the core of the encampments. There's no difference in the operation of the encampments. There are agreements between the residents and encampments of the housed neighbors. Both communities have benefits that make them all feel safe and part of the community as a whole. For example, encampments make sure there are no issues with trash or unsightly collection of possessions. The residents of the encampments do not harass the house, and the house do not harass the residents. The campers also offer services to the house, such as cleaning gutters and mowing lawns. The cost schedule of benefits of tents allow for quick and inexpensive solution to housing many people to get them off the streets, bridges, parks, and on-ramps where they are currently forced to reside. The tents can be upgraded to sleeping cabins or tiny homes once the camp becomes established. The proven results can then be scaled up to meet the needs of the encampment. In closing, we need to add to the homeless plan all interim housing options that we can think of. This is an emergency that we need to handle right away. Thank you. And I'm still homeless. Thank you.
Thank you, Robert. Good luck. Ms. Stiltz?
Yes, Mayor Liccardo and City Council members, I am a resident near the corner of Monterey and Branham, and I have a letter and a petition with over 100 signatures of my neighbors and I who are opposed to having a tiny homes community set up in that neighborhood and also on the corner of Monterey and Burnell. I haven't heard you talk about this part of the issue today, but I know it was a proposal that was brought up at a meeting at the Hayes Mansion. My neighbors and I are actually appalled. We're also, some of us, distraught that you are considering a proposal to set up a tiny homeless community on the corner of Branham and Monterey and Monterey and Burnell. Our neighborhoods are made up of families with small children and vulnerable senior citizens, and we will not stand for a proposal that would put their safety at risk. That would cause children to fear walking to school or to be afraid to ride their bikes or play outside or to cause others to avoid walking on Branham. Additionally, our South San Jose neighborhoods are especially sensitive to factors that affect property values. After years of waiting, we are only now beginning to recover from the 2008 recession and subprime mortgage loan crisis that left many homes here in foreclosure. We will not tolerate a poorly thought out decision from the City Council that would jeopardize that recovery.
Thank you, ma'am. Thank you. Ms. Kramer?
Thank you. Hi, council members. My name is Deb Kramer. I'm with Keep Coyote Creek Beautiful, and I appreciate the time to share a little bit about my perspective. I agree there's a countywide, community-wide homeless problem. In fact, I participated in the winter census and saw firsthand the impacts of the people living out of their cars, probably because of the high cost of housing, few affordable housing units, low wages, and illnesses. I also observed, as I mentioned earlier, a lot of mobile living spaces, but I also see a lot of people living along our creeks, especially Coyote Creek where I work. We need help. We need to help the homeless, and this is what your agencies are doing and what Measure A that the individuals voted for, the residents voted for. My organization and our thousands of volunteers each year see the impact of homelessness on our waterways through trash, polluted water, limited aquatic life, and additional problems that we see. As Ray Branson mentioned, there are a lot of impacts in not helping homeless folks get off the streets. and while minimizing the negative impacts on other community assets, such as the creeks that lead to the bay, public parks for everyone to use, such as St. James, where the current model to help people move from the Good Samaritans move to other locations. We have the same problem at the Tully ball fields, where about 100 people come to get fed, and the wildlife that depend on the clean water. Examples of these community impacts are increased trash in our waterways, as indicated in the presentation, and also increased water pollution from defecation and batteries, as indicated by the State Water Board permit. We also see drug use and dealing in our creeks. I have a few requests of you. One is that you ask the homeless advocates to stop providing food in our parks and instead, as you're doing, to partner with existing service providers. This is a list of the service providers that we can give out to homeless individuals we encounter. It's a win-win-win-win, where the Good Samaritans feel good, the service providers feel good, and people get help. This will reduce health risks to all, including the vulnerable homeless, reduce the cost to the agencies for creek, street, neighborhood cleanups, and reduce waste pollution to the bay and increased water quality for a healthy waterway. Thank you.
Thank you. Welcome, Alfonso.
Members of the City Council, I'm from District 2. I personally have a cousin who lives in San Francisco who used to be homeless. So I know how it is, how difficult it is, because I know her personal story. And which is why I would like to have, the project to really succeed for us. And I really commend the city for trying to be at the forefront of solving the homelessness issue. However, I'm also concerned, that as a homeowner too, we also have our concerns. The city has not really shown all of this or addressed all of these concerns that we have. So I think we need to balance these two. Not everyone who is asking or questioning in the system is saying that we are against the homeless. The mere fact that I have a formerly homeless cousin, and I know how she succeeded, through the system, does not mean to say, now that I'm questioning, is everything going to be fine? Did the city really looked at all the ways, to make sure that the system is going to work? Because history will tell us years down the road, is San Jose really, did they succeed in doing this? Are we going to be the prime example of solving the homelessness issue? Or are we going to be the butt of joke of all other cities? So let's think years from now, ahead of time. Let's not be just like nearsighted and think of what it will be after our term ends, after the 4 years that our term ends. Let's think what will happen after 10 years, after 20 years. Has our city succeeded?
Thank you, sir. Ms. Cartwright?
I didn't hear any mention of the fires because the loss of jobs and homes will certainly impact us. We definitely need more family shelters. There's 60 families on the waiting list. Bernadette and Rick were on that list. They're also, they can tell you, they got the $500 voucher because they were part of the floods, and they lost everything that they bought with those vouchers in the sweeps. So they got everything, they lost everything. So that tells you how good sweeps are. Right now, there's a 3-year-old child living in a tent. So we definitely need more family shelters. The Housing Authority, if they wanted to help, they could help a lot right now because they could provide just cause for buildings that have voucher holders. So if a landlord wants to put somebody in with vouchers, they have to prove with just cause that tenancy was not the result of an illegal eviction. And they could do that right now. They've chosen not to. Here's solutions. Cortese's RV idea. Sanctioned encampments that you guys approved 2 years ago, and so did the county. Safe parking. There are vacant lots all over the city that we could utilize right now before developments go in. We could use that vacant lot before they break ground. And shelter in a box. Rotary does it right now. They do it in disaster zones. They show up, boom, open the box, you've got a shelter right now. They do it all over the place. And last, tonight, I hope you guys will join me at our 4th potluck in the park with our unhoused neighbors, St. James Park. And I will do it right in front of that stupid sign, which does not serve our neighbors, because our unhoused people who are elderly and disabled cannot get to half the locations that are listed. And I am not stupid. I do know how to do this. I am an advocate. I send them to housing. I find people housing, and I feed people. And I will continue to feed people in that park because people need food and they need housing. Those signs are not adequate, and they do not give people actual directions. Take down those stupid signs.
Bobby Yotes. Bobby Yotes, followed by Scott Neese, Joe Salvato, Eileen Hunter, and Roland LeBrun. Scott, come on down. Whoever's able to get down first. Sir, if you'd like to speak, just submit a yellow card. We'd be happy to call you up. Oh, you did? Okay, great.
Good afternoon, Mayor Liccardo, members of the City Council. Scott Neese, Executive Director, San Jose Downtown Association. I'm really encouraged by the presentation I heard and the collaboration and the willingness and of looking at kind of any port in a storm, because we are in a storm of homelessness in this community, and every option seems to be under the table, and there seems to be a willingness to embrace it and look at, including some of the good ideas that we've heard from many of the speakers. Probably like many of your offices, we've seen a dramatic increase in our office over the last 5 years of complaints and concerns about the issue of homelessness, and it's not going away. We know this is the way out, to create homes for those who want them. And it's great to see so many of them here in downtown and in District 3. We're going to need to spread the love in the rest of your districts too, for us to be able to accomplish what we need to accomplish here. And there was a statistic given, the 91% want to be housed. I think a lot of those 9% are in downtown, and these service-resistant individuals are really the tough ones. And I know that Councilman Morales has got an idea on the table for how do we kind of marshal some of the resources for these really tough cases, and being able to look at Laura's Law and any tool that we have in the toolbox to help those that are mentally incompetent or in danger to themselves or others. I think we have to remember that the unhoused alone are not the only victims of homelessness, and it's not just the creeks and the waterways, it's the residents and the businesses and the sidewalks that are affected by this too. It's going to take a village. We're part of the village. We're all in with you.
Thank you, Scott. Welcome. Eileen.
Hi, I'm Eileen Hunter. Oh gosh, homelessness isn't one face. I think we all know that. Sparky mentioned the youth. I talk about women, elderly. There's just not one face, and we need to stop addressing it as one face. We need to look at each person and what their needs are, and I think if we start chipping it away at it from that way and stop saying homeless, 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 we'll all be better off. I was a case manager. I did Housing 1000 case management with people living in the jungle. My time was mostly spent looking for people, looking for housing, looking for people, looking for housing. Once they left the jungle, I couldn't find them. They would go one place, the next. I also had to try and fit in taking them to court, taking them to doctors, just trying to get them to budget, pay their bills. It was way more than one case manager can do. The other thing I found is that they have a strong community. They love each other. They give each other special names, grandma. They create their families there. You put them in permanent housing, they lose that. They feel isolated. They lose their community. So they either isolate, don't go out at all, which I have clients that have done, or they bring in their community that they had into their places. A lot of mine were at Santa Clara Inn. A lot of them are out on the street again. They lost They're case managers. They are reconnecting now, but they're still homeless. I work with women now. They come confused. They don't know where to go. Yes, the Georgia Travis Center is closed. There aren't places where they can just go. You have to build trust. It takes time. It takes a lot of energy and time to convince someone to come inside. It's a lot of work. And the way you do it is you put a face on the person. They're a person. They're not homeless. My new passion that I'm pursuing now and wanting you guys to listen about is senior independent living. When someone has money, where do they go? They go to independent living. I had a man move into one of my clients' apartments. She was in detox. I had to kick him out. He died a week later in an encampment. That was the hardest thing, I think. One of the hardest. There were so many hard things I did as a case manager.
Thank you.
But I had to kick him out, and he died a week later. His family took him back out to the encampment. He burned his bridge.
Thank you.
Sorry, I didn't know you were saying
thank
it.
you. Yeah, it's me.
I'm sorry.
It's me. It's okay. And we have Bobby Yotes, Joe Salvato, Roland LeBron, and John Betts.
Good afternoon.
Good afternoon.
I believe all of us have concern and empathy for our city's homeless, and we recognize the great need for housing and services. But I would like to say that many of us do not agree with the housing first concept in neighborhoods. We would like to see some eligibility criteria, mandatory services, participation, and some type of community service required by those who are mentally and physically able. There needs to be elements of accountability and responsibility expected of people who are being assisted by our city. And I want to stress that opposition to housing first is not opposition to helping our homeless, as some would like to imply. It simply means we believe there are other more comprehensive ways to ensure long-term success for the people needing help. Let's explore these other methods further, some of which have been suggested just here today at the meeting. People are concerned about what Housing First lacks, and there's a lot of emotion associated with this issue because our neighborhoods are in the worst shape that I've seen in my 27 years of living in San Jose. We want to halt the erosion of our neighborhoods. We would like to see the time, effort, and money invested in our homes and neighborhoods count for something. Placing Housing First facilities in neighborhoods does not seem the way to accomplish a neighborhood resurgence. Lastly, and I say this respectfully, I know there have been differing opinions on the council, but I would like to let you know that we all want our council members to represent our districts rather than their own personal agendas. We expect them to hear their constituency and vote in accordance with the majority of the district they represent. They are elected to be our voice, and many of us feel like our voice is not being heard. We respect the right of every individual to have an opinion.
Thank you, ma'am. And ma'am, your name? Ma'am?
Bobby.
Thank you, Bobby.
Hi, good afternoon, Joe Salvato, and thanks for your time in discussing this important issue. In my years working over at the Guadalupe River Park, I've seen firsthand the human dignity component to this issue and the impacts that encampments have on our waterways, our parks, and on our overall quality of life. As the Guadalupe River Park is not designed for camping, it lacks the facilities to support the nature of inhabitants that's present today in the park. As such, the numerous encampments pose a public health and safety risk to the inhabitants themselves, to park users, to city and conservancy staff, to volunteers who are involved in our education programs and in cleanup efforts on the river, and who just aren't equipped for the exposure they have to things like used syringes and clothing and bedding and items that are soiled in human excrement. We recognize the unique challenges that we're facing right now with the jobs and housing imbalance, and appreciate all the efforts that are being made to end the cycle. However, our concern is that the segment living in our parks and on our waterways, many of whom face mental health and addiction challenges, aren't being reached by existing efforts. And so I encourage you to explore solutions that address this population that's seemingly falling through the cracks. Thank you.
Thank you so much. Roland LeBron, John Betts, and Gary Fishburne.
Thank you. So as you can clearly see over there, we have a problem. We have got 4,000 homeless people, and next month we will have 63 units ready for occupation. It's a crisis. It rained last night, which means we have to do something not tomorrow, we had to do it yesterday. So what I want to do, which hasn't been discussed today, is to bring the bridge housing back to the table. And what went wrong last time? And in my mind, there were two things that went wrong. It's number one, it was just dumped onto the community. So there was no engagement. As you heard from many people here, there are people all over San Jose who want to make this work. So what I would like you to do is to go back to Mayor Liccardo's plan, which to basically spread it evenly across all 10 districts. Not forgetting that District 2 has already got 130 beds that you don't know about on Bernal Road, because they are an incorporated area in the Muir Right Range. We know how to identify parcels and to get community buy-in in District 2. Just give us a chance, and I'm sure the other districts can also do this. The last thing I want to touch on is the issue of cost. The cost projections for staff is just, as Council Member Camis pointed out, which is not reasonable. You can go and buy these sheds from Costco at $2,000 a pop. You can buy a mobile unit with 3 toilets and 4 showers, nearly brand new, surplus, for $40,000. So just start doing the math. We absolutely know how to make this work. All we need from you is some help and some leadership. Thank you very much.
Thank you. John Betts and Gary Fishburne.
Hello, thank you. Well, let's see, I'm a member of the Sacred Heart Housing Action Committee, and I'm also the member of the La Mesa Verde Community Garden group that's supposed to be providing the community garden for the Evans Lane project. So I just want to speak in their behalf that we want to see if that Evans Lane project can really go forward and not get bogged down in a whole bunch more red tape. Also, just want to say, I've been homeless myself, and vehicle dwelling is probably about the only way I've been able to be housed for about 9 years. And I've lived in mostly Palo Alto, Mountain View area. And also, I'd like to say, even though this community thinks they're the most progressive community on earth or something like that, and we have Silicon Valley and all that, but when I was homeless, I had better results when I was in Las Vegas, and my girlfriend and I went there. She had to apply for a job one time, and then we had to wait 14 days for an answer, and we had no money to stay anywhere. We were able to get in a shelter right away, just like that. Someone gave us the phone number of the shelter. We called them up, and they just said, okay, come on down. We were able to get in somewhere right away within an hour of speaking to somebody, and we would have been completely in a horrible situation otherwise, like many people here are all the time, because here the process to get in anywhere takes forever, or sometimes you have a shelter and then you have to go get a referral slip each day from your caseworker to get to go into the shelter again that night, like at the We Hope shelter in East Palo Alto. So I think a lot of these things need to be speeded up, and the whole thing of making more places for vehicle dwelling, tents, etc., get it together. Don't make everybody wait another year out in the cold while you study a whole bunch more things. Okay, that's
Thank you, sir.
basically it. Thank you.
Thank you. Mr. Fishburne?
I want to speak about a meeting I attended last week it's a proposed warming center. This center is in a existing senior center, which I'm going to speak for those seniors that were at that meeting and were opposed to the center for health reasons. Those reasons were the hepatitis outbreak and other diseases that they are vulnerable to at their age. So at that meeting, they expressed they do not want that warming center in their center. Also, we did have someone from the city, maybe it was a subcontractor of yours, that comes in afterwards and cleans the facility. Well, from the time that this homeless leave, 1/2 hour later, the seniors come in. And I believe that is not enough time to clean these facilities thoroughly for these seniors. They are at risk and they don't deserve this. I hope you can find another location for these homeless. I'm in favor of warming centers for the homeless. I think it's a great idea. But in this location, I think it's wrong, and I'm speaking for them. Thank you.
Thank you, sir. I want to thank all the members of the community who came to speak, and many of you I know have been working for a long time on these issues. So appreciate your continued passion to address this crisis. I know we had a request from several of the community advocates who had coordinated their public speaking about having time for a separate panel. And I certainly appreciate the intent behind that. And I know many of those advocates are people who have been working in the community for many years to help us. And I declined the request for a couple of reasons. One is because I think it is very difficult for us to identify any one group that speaks for the homeless community. We know this is a very diverse community with a lot of different needs. The one need we'd all agree in common is housing, but there's a lot more to it than that. And I think it would be difficult for us to say that one group or another can adequately speak for what we know a very multifaceted and very complex set of challenges. So we appreciate the request, but I think the points were well made, certainly by the group of 8 people, and I think collectively they got 16 minutes, so it probably all worked out just fine. I want to go back to this list that you have right here on the screen right now, Jackie, and first say thank you to you, Ray, and everybody on your team for their hard work in getting us here. We know we've got a lot more to do, but this is a lot as well. I know this is the permanent housing that we're working on. We've got a whole set of other initiatives we're working on as well. We've tried RFPs on safe parking and looking at tiny homes and interim housing and so forth. And I guess what I wanted to say about all these different forms of housing is I think we get really wrapped around the axle around whether it's going to be a sanctioned encampment or a tiny home or interim housing or it's going to be permanent housing. And really the fundamental issue, if we have the money, the issue is the same, which is where are we going to put it? And until we get past these siting issues, we're not getting anything built. And that's the really hard work. And I'm hoping that some of the energy that has been, I think, unfortunately channeled into, we don't like this kind because it's tiny homes, we don't like that kind because it's this. We really got to focus our energy in finding sites, or we won't get people housed. And so I hope that as we're thinking about this going forward, it will be less about the what and more about the where. And I appreciate that we've had increased cooperation since our last meeting from the Water District and Caltrans and others. Hopefully that is helping to broaden the potential inventory of sites, and we know we're going to need all of them and more. Quick question about motels. I know the economy's been good, so it's probably not a great time to go to a motel owner and say, do you want to sell? But are we hearing anything, or have we had many conversations lately about folks who are ready to allow us to convert their motels?
We have. So we had looked at a couple of hotels that appeared to be on the market, but the cost was just so expensive. it didn't seem like viable projects. But
Okay.
we do keep our ear to the ground, and we've heard of another hotel that we're going to follow up on. So we do occasionally get leads on them. We do follow up when we get them.
I know those are typically better counter-cyclical options. And I know when we were talking about this originally, it was during a time when, you know, things were a little cheaper. Obviously, not now. But I hope that, you know, we know eventually the downturn will come, and I hope that maybe we can take advantage of that opportunity when that happens, to be able to get some hotels and that we can rapidly turn around for apartments. Key, I really appreciate your presentation. There's a lot of data in there. Question that constantly comes up in public discussion when everybody blames Reagan for creating the mess of closing inpatient psychiatric facilities throughout the state is there any way for us to go back? Is there, I mean, looking at the $520 million we're spending annually, and we know most of that's coming from the county, does it ever look financially feasible for us to start to say, let's go back to inpatient psychiatric care? For an awful lot of folks who are struggling mightily right now on the streets, and think about a better model.
That's a good question. I'll answer it in two parts. The first is the conversation locally with our special mental health system is really so far been about reducing unnecessary utilization of those acute beds, those state hospitals. So our behavioral health services director and our county are looking at ways to improve our our local mental health system so that folks who don't need that level of service don't need to be there. Of course, getting them out requires places for them to go. In terms of whether the state would consider opening up additional beds, I think that's a conversation that we'd have to have with our state.
Okay. And while I got you, Laura's Law, I know was raised by Scott Neese. Several counties have sort of opted in. I'm not sure what the right term is, but essentially enacted ordinances enabling us to utilize that. Where's the county? Where's the county likely to be on that?
Sure. Supervisor Chavez directed our administration to bring back a study of recommendations on assisted outpatient treatment. That went to our Health and Hospital Committee on September 13th. And the result of that conversation is that the county is really focused on, again, improving all of their specialty mental health system for the adults and not looking at the adult outpatient, assisted outpatient treatment at this time.
I'm sorry. So I guess I was more focused on whether there would be any options for city or county response beyond the 5150 holds. And my understanding is that Laura's Law would provide another option where there seems to be some risk of harm to the individual or the community. And so I'm sorry, I didn't quite understand your answer.
Sure. The Health and Hospital Committee, in their discussion with the administration, said that at this juncture, they are focused on improving the specialty mental health system, but not looking at the AOT, aka Laura's Law, at this time.
Okay, so the committee declined to go forward. Okay, so that means this won't get to the board.
That's correct.
Okay. And at this point, the committee is, I think it's 2 members of the board, is that right?
That's correct.
Okay, so we should go talk to those folks if we want to persuade them otherwise. Got it. Okay, and that's Supervisor Yeager and
Supervisor Simidian.
Got it. Okay, that's helpful. Thank you. I thought Sparky Harlan had some pretty interesting statements. We saw a huge spike here in youth homelessness in the last count, and I know it's very difficult for us to figure out cause here and whether or not, it's not clear to me whether we just had a lot of homeless youth before we weren't counting or because I know that the method of counting has changed. We've got a lot more, we had a lot more folks, particularly young people, I think, going out in outreach in this census, as I recall. And I saw it when I was out there in the classrooms. There was a lot more folks, seemed to be college students who were helping, which is great. But it's not obvious to me whether we figured out, were we missing them all along? Did we overcount this time? Is it some combination of all the above? Or was there just something that happened in the last 2 years that we missed? Do we have any insights on that?
Yeah, essentially, we put more effort and resources into the youth count. The youth count actually happens kind of during the day. So I think we kind of doubled the number of teams that were out there. And so we found more individuals.
Okay. Do we think, all right, could you give me a sense in terms of my question, which of the scenarios it seems to be the case? Are we seeing a rapid rise? I mean, I think we saw a stratospheric rise in youth homeless. Were those folks simply not being counted 2 years ago?
Definitely, I think one factor was the undercount, and the point in time is always considered somewhat of an undercount.
Yeah.
And second, I think in the briefing that we had for all the elected officials and the various stakeholders, I think another factor is that young adults have less resources than other individuals and are more likely to become homeless. Which factor accounts for what percentage of the increase, we don't know. But I think, it's really incumbent upon us now that we have this piece of information to implement programs that are targeting those populations. We've seen when we focus on chronically homeless individuals, homeless veterans, we've seen consistent decreases. So we should look at programs that would be effective for those populations.
Yeah. I mean, when Sparky said it's really about getting them back home, it's not about permanent housing. I know that Sparky probably didn't mean that to be universally true in every case, but certainly I think I took the point, which is under 18? Under 18, right. Right. And so I'm sure there are situations of abuse and so forth where it's just not the case, but our point's well taken. And I guess the question is if that is really the situation, and it would seem to be a much less costly approach than actually building housing. Is that an area where we can readily pivot?
Absolutely. I mean, when we begin to engage individuals and if we determine that it is an appropriate intervention to return them or help them go home, then we should try to do that. We should note that sometimes those individuals are leaving home for a reason, and so we just need to be cognizant of that.
Yeah, absolutely. I know there are a lot of difficult situations. Okay, well, thank you for all your responses, Key. And I didn't mean to preclude anyone else from jumping in. So certainly if there were other opinions, I'm happy to hear them. I know I heard some suggestion about additional task forces and committees and so forth, and I just want to suggest, as we look at that list of just the permanent projects that we have underway or in the pipeline, and there's a whole lot more that we're doing outside all that. The more meetings we have, the more study sessions, the more task forces, that means these really hardworking people are in here talking to us rather than doing the really important work they need to be doing. And this is, the people who stood up are some of the most overworked people in our city. I really would like to relieve them of additional meetings where we know their work plan is so incredibly robust already. And so I would like to gently push back on the idea of more task forces and more study sessions. I think what we really need are obviously resources and enabling them to really focus on all the work that we all collectively want to get accomplished. So appreciate what's been done so far. And I believe many of my colleagues would like to ask some questions. Councilmember Morales.
Thanks, Mayor. And I want to say thank you as well to everybody that came out, Jackie, Jennifer, Ray, Key. Thank you very much, Francis, or I'm sorry, Frenchie. Excuse me, Frenchie. Thank you so much, Frenchie, for coming out and for sharing your story with us and the success of really the work that we can do on an individual basis. And thank you even more importantly for giving back and being able to provide your assistance now, your knowledge to the community, and I know that I've seen you do it out in the community with other members that are out there that are in need and that are in the shoes that you were in. And so it's really important to have individuals like yourself here with us and share that story. So thank you very much. And congratulations as well on your success thus far. Key, I wanted to follow up, being that we sort of ended some of the conversation with you, or the mayor just did, and touch on the Measure A dollars. We had a couple slides of 44, 45, 46 on those, and a couple of things. So one, if you could just provide a brief update or picture that gives us a timeline of when, for instance, slide 46, I believe, which kind of denotes some of the existing and pipeline projects across the different jurisdictions, when we might be able to start seeing those Measure A dollars now into some of these different jurisdictions, including our own here. If there is, I know that obviously we're at the beginning here still, but if you can provide an update on that.
Sure. Towards the end of September, our office did issue our notice of funding availability for what we call the Supportive Housing Development Program, which is mostly funded with Measure A. We have essentially an over-the-counter process in which we will be evaluating proposals. We have received about 10 or so proposals, and we will be bringing forward those recommendations for funding as soon as possible. I think our initial estimate is that we're going to bring forward a set of proposals or set of recommendations on November 14th. And just to be clear, it would be responding to mostly projects that are kind of already in the pipeline, or they're just kind of finishing up at their financial package.
That would be the most immediate ones coming back, you're saying? Right. So that wouldn't necessarily add anything to this pipeline?
Well, there would be a little bit to that, but...
And if we don't mind bringing up that slide, I know we have the screen up, slide 46. Yes.
I think let's see, that's a total of 11 developments. I think a majority of those are a part of our the proposals that we've received, but maybe a handful are not.
Okay, and then in line with that, what percentage do we know as far as each of these different jurisdictions? We do have an idea on maybe the amount of homeless, the population that it looks like throughout the county. Do we have a comparative on how each jurisdiction is doing percentage-wise on now their existing or pipeline projects to be able to address this problem sort of equitably throughout the county? Clearly, there's some that don't have any or don't have any existing and don't have any in the pipeline. So there's an issue there, but there also may be issues in regards to just the sheer numbers, and that includes the city of San Jose, right, as well, knowing the number of population of homeless that we have in our community and the need that we have. But I'm just curious if there is a chart like that. I didn't see it in the presentation today, so.
So first, when we presented our goals related to the Measure A implementation, we indicated that over the next 10 years, we wanted to use this opportunity to create roughly 5,000 units of extremely low-income housing or supportive housing. That would basically result in basically 10,000 units countywide. And many individuals asked us, are you going to require certain cities to have their share? Of course, we, the county, don't really have that power, but we did say that we want to try to support developments that are distributed kind of very close to RHNA allocations. And so we have those charts, and then we can show once we can bring forward the recommendations to the board, how our Measure A funds would be adding to that and whether it's meeting the distribution. And I would say that the city of San Jose did a great job of basically inventorying all of their affordable housing at which income levels and which of those are supportive housing units. That is a task that we hope to work with the cities on, or the rest of the cities on, so we can have a more comprehensive picture of all the restricted affordable housing units and the supportive housing units that exist now and in the pipeline.
Thank you. Next question is in regards to slide 34. It shows our capacity for supportive housing is 1,330. Do we know what percentage of that capacity we're using today and on average?
Yes.
That one, yeah.
Although I don't have that specific number in front of me, but I recall that 1,300 is our budgeted capacity, and I think we have 800 individuals housed, and then a certain number of other individuals who are enrolled but unhoused. So we can come back with that specific information.
So 1,330 is the budgeted capacity, or that's the actual households that we have?
So
under
we
that designation?
that represents how many people we can serve. So, if everyone was staffed up, we'd be enrolling 1,300 people and trying to house them.
So I guess what's the biggest hurdles there to maximizing the capacity?
Well, two things. First, it is extremely difficult to hire staff for these positions, and this capacity is really the county staff plus 6 community-based organizations, Abode Services, PATH is one of them. So it's really difficult to hire staff. So that there's a process there. And the second piece is, again, locating individuals, engaging them, enrolling them in the service, and then actually finding them housing. I think only about less than 15% of our housing capacity are actual units. All of this is mostly tenant-based rental assistance. And that might change significantly when our new developments come online, but it's still just a lot of tenant-based rental assistance.
Okay. I guess as part of it was maybe the confusion in just the slide. I envisioned it as households, not capacity to house people in that many, households or units. So I was envisioning it as that many units. And so, and it does make sense, certainly, as you're saying, the capacity that we have as far as financially goes to house that many, if we could staff up and have as well our partners be able to staff up to do so. Now, I guess what concerns me, and then I'm hoping there is plan one, I'd like to see that, right, we are reaching our full potential, and I think that's everybody's interest, right? If we have the capacity to help X amount of people, we should try to reach that goal. Granted, there's a lot of other factors, but once we do get more of these developments and these units that are in the pipeline completed, what I would hate to see is just that capacity increase, but then our ability to actually house individuals not, right? And so we're not matching the amount of developments in the pipeline with the support that we know that we need to actually fill those vacancies. So has that been, is there a plan in place? Is there something comprehensive?
Sure. Through the county's housing task force, which met through most of 2015, the county understands that one of the reasons that we do not have a lot of supportive housing is because in the past, the county, did not play a significant role in the delivery of services for those supportive housing units. So there are siting issues, capitals, operating subsidies, but also our ability to develop, operate permanent supportive housing is predicated on our ability to provide the necessary supportive services. So, for example, we have 3 developments in the pipeline now: Villas on the Park, Renascent Place, 2nd Street Studios. At the proper time, the county will enter into agreements with those organizations to provide the necessary supportive services. And we estimate that on an ongoing basis, supportive services for each unit per year is roughly, in the beginning, about $10,000 per unit per year. This is not all county general funds. Some of it's federal Medi-Cal dollars. But we know that is a critical piece to all of this. And if we don't have funds for services and permanent supportive housing, then we might shift developments to rapid rehousing or other special needs populations.
Thank you. Yeah, I think that's certainly, that's key. I mean, we're putting in the efforts. Certainly Measure A was developing some dollars, but the city as well has been developing dollars. We're trying to increase our actual unit count, but we want to be able to use that to its full extent year after year, because, if we have capacity, but yet we're not utilizing it, then that means that's one more person that's out,
Right.
on the street. And so it's
Councilman,
important.
just to make it be clear, once Second Street Studios comes online, our capacity would reflect 1330 plus 134.
Thank you. And thank you for answering about Laura's Lawn and where that's at. We had a couple advocates come up and speak, and I know the mayor mentioned it in his comments in regards to the interest. Sparky mentioned it. We had some other advocates about an interest in a further conversation, and certainly we had some advocates that wanted to participate a little bit more today that were able to speak during public comment. But I would agree with that thought, and I would disagree with the mayor's comments in regards to the value of and weighing the value to what it costs of having a more I think concise and regular collaborative effort between not just the city and the county, but our service providers that are out there, be it as well the development community, the first responders that go out to deal with homelessness on a daily basis. We certainly see that coming up in a number of conversations, but really a really good collective effort. We've had this happen a few times along the way. We've certainly had the county lead some ad hoc meetings. We've had now this study session, which I think is very beneficial. But what we haven't had is something that is consistent and fully collaborative between all different bodies. And I'll give you the example, and this is the example I shared before, and this is the example certainly that I'd like to see come to fruition and that I'm working on, which is something that would mimic our Mayor's Gang Prevention Task Force, led here by the city, but inviting the partners from all different agencies that participate in one overarching goal, which is to be able to address the issues in our community with gangs, and really to try to be able to support our community from all different angles. And we have courts and probation, school board reps, county, city, police department. It's a great collaborative organization, one that has been now mimicked across the country. And although, yes, it does create the need for yet another meeting to be able to address this issue, what I think it does well is it combines all the stakeholders that have an interest in this one overarching issue, and it allows us to work more efficiently and collaborative, and to not have to maybe do these ad hoc check-ins from time to time when we feel that there's a need, but yet to have that on a regular and more consistent basis. And I don't think anybody would argue that housing and homelessness is not our most pressing and priority issue of our time. And certainly that is still as well a case for gangs and gang violence and trying to prevent our youth from getting into gangs. But I don't think you could challenge that is a more pressing issue than housing and homelessness right now in our community. And so, yet we don't have an effort like that. We have this. We have intermittent ad hoc, meetings or a study session here and there. I actually think that we could probably relieve some of the strain and the inefficiencies of having these kind of meetings. And I do believe there are actually good efforts around the community, but just disjointed. And potentially we can work more efficiently together, and I think we could do so if we did work together more regularly. And that would be my hope. I know I've had conversations now with Jackie and Jen Loving, and certainly that's my interest, to at least try to pull together the right stakeholders to at least convene one time and see if there's an appetite and an interest for it, which would include convincing our mayor as well, that this would be an efficient use of our time. And I get it. Certainly, everybody is working their tails off here. But anyone, especially in a crisis situation, would readily admit that if we are not stopping or pausing to collect ourselves and put together a good plan, and we're just all kind of going out there trying to hit the ground running and assuming that we're just each individually going to be doing the right thing, and somehow at the end of the day it's all going to come together, we're fooling ourselves, because that's not the case. This is a big enough problem that I think needs a really good collaborative effort. And so hoping to get there, hoping to invite our community members back to be able to have a study session similar to this, but to have a more regular, consistent opportunity to do so. But I thank you for coming here today, for participating with us, and for the efforts that we are putting in, and look forward to taking on this challenging task, all of us together, as again, I think that is our most pressing issue of our time. Thanks.
Thank you, Councilmember Perales. Councilmember Jimenez.
Thank you, Vice Mayor. Thank you, everyone, for coming. We appreciate it. Certainly, some of my residents are here. Thank you for coming. I think it's always good for people to be engaged and connected to what's going on. I just had a few questions. I think the first one is for you, Key. I was wondering, I had a talk with one of the supervisors some time back, and I don't know all the details, but I'm hoping you can sort of fill us in. But my understanding is your department, or the housing department for the county, was given direction to potentially go find some bridge housing sites, or some sites in which some of that could take place. I don't know if you're able to speak to it, but if you can share a little bit about that.
Definitely the county has prioritized the development of permanent housing. However, we are also actively trying to increase the number of temporary shelter or temporary housing units or beds. In various referrals, the board has reinforced that. That has led us to expand the cold weather shelter program, for example, by 60 days. We're working on opening up a cold weather shelter in Mountain View, for example. They have also directed us to try to establish a safe parking program, an RV parking program, tiny home village program. And just actually yesterday, at our Housing, Land Use, Environment, and Transportation Committee, I recommended that the committee consider setting a goal of increasing the total number of beds by about 500 over the next 36 months. Obviously, about half of that is kind of already in the pipeline. So kind of gave ourselves a running start. But the idea was that to focus on the goal of more beds of some sort, and then trying to get there through various means rather than focusing on just one type, because I think sometimes that people have different feelings or connotations when we say tiny homes or sanctioned encampment, and that just sparks a lot of miscommunication from the get-go. If it's about trying to provide some temporary relief to individuals in the form of some type of safe shelter, then I think that should be the goal. That was the idea there.
So it seems like you guys are looking at a lot of different things.
Yes. I will say that we had a referral to establish a safe parking program in the city of Mountain View. City of Mountain View was supportive. There are currently no safe parking programs in the city of Mountain View. So it is a hard thing to do.
So one of the things I'm curious about is, obviously, I think we did the study session, was it last week? And I think safe parking was something that emerged as one of the top sort of things that we wanted to prioritize. So what I'm wondering is, we've never done safe parking. Is that safe to say? I know some churches have done some work.
No, Councilmember, the city has issued 2 RFPs for safe parking program operators, but no responses on those. And there are some churches that are doing it privately, but nothing funded by the city.
Okay. So I guess what I was wondering is, it certainly seems like the county is putting forward some efforts and sort of, I don't know who's, potentially mimicking some of the things that the city has done, or we're mimicking them, I don't know, but they're doing similar type of things. So what I'm wondering is, what level of collaboration can occur, say, for example, if they're doing safe parking in Mountain View, but then we in San Jose say, hey, we want to do safe parking here. Is the county open to looking at working with the city housing department and try to figure out, help us along with one of those priorities that we identified?
Sure. I mean, we communicate often, and if there's an idea in another city, he's more than willing to always share those ideas. If they were to find a provider in Mountain View, I'm sure he would let us know immediately, and we would reach out to that provider once we have an opportunity. So I think communication flows very freely. He acts as the conduit because he has the relationships with the other cities, and he's very good at feeding the information back to us.
And if I can add, I think our efforts kind of piggyback on each other's. For example, because the city of San Jose passed that temporary shelter, incidental shelter ordinance, one of the ideas that we had is, how can we provide a little bit of, this as what we proposed to the committee, provide some type of mini grants, one-time mini grants for small organizations that want to provide some level of shelter. I'm talking about like 5-10 beds,
Like a church that's opening up their doors.
Right.
And you say, church, we can provide you with a mini grant to help get some people off the street temporarily. Right?
Exactly.
Okay.
And actually, last year, there was funding by the county that went through the Housing Trust that churches could access in support of the city program.
Okay. Yeah, thank you. Yeah, Kia, I was asking, certainly, I think you're the county representative here. So that to me is very important. I think it's always important for the residents, anyone watching online, to see that there is someone from the county here, because oftentimes one of the concerns of residents, as it's been expressed to me, is that we don't often talk or we don't work together. And so with regard to the county, sometimes my residents, and I ask this because I'm sure this is something that Jackie's certainly probably heard many times, and I've heard many times, and I've tried to explain it as best I could, but maybe I haven't done a very good job. But why don't we open up the fairgrounds to do some of this housing work, right? Whether it's safe parking, whether it's bridge housing. And I didn't expect that, by the way. It's a sincere question. I mean, I explained that, the county's separate from the city, and you guys have your own ideas and plans for the fairgrounds, but.
I think what I say about the fairgrounds is that the board has been for many years looking at the best way to redevelop, reuse, improve utilization of the fairgrounds. We went through, in the latest round, we went through an RFP process to identify proposals. Those proposals have been received, and the board has not yet acted on those proposals.
And the other question I had is sort of relation to Measure A funds. We were talking about, or I think there was a question by the mayor, and this is something that Jackie and I have talked about, the purchasing of motels, right? Along Monterey Road, where we have a lot of homeless folks, there's some motels some are active, some are closed, and I know obviously prices are quite high now, and the cost would be expensive, but what I'm wondering is, could we use Measure A funds to purchase a hotel or a motel?
Yes, Measure A funds can be used to acquire and improve real property. Yeah. If there was an opportunity to acquire a motel and it made economic sense, there was long-term redevelopment proposal there, that would be something that we could consider. We've actively also tried to buy master lease motels. It is a difficult proposition. Many owners do not wish to sell.
And I would just jump in. Many of the motels are not zoned or general planned residential, and that would be a challenge for using Measure A dollars. So unless we are willing to do some sort of conversion on those, that would limit the county's ability to invest, unless we could find another funding source that didn't have a longer term requirement to provide affordability.
And when you touch on the word conversion, I know oftentimes we've had that debate up here about converting land, right? Revenue generating land to housing, essentially, right? But has there ever been, that makes me think of something else. Are there ever for lack of a better word, temporary conversions. So we say we want to convert that for 10 years. That's it.
Yes, actually, so the council did approve some legislation that allows us to do some short-term conversion, and it is actually for 10 years. But it's really finding a funding source that has such a short-term requirement. Most of our money has 55-year requirements where we want to see very long-term extended affordability time periods.
And when you say most of the money, you're talking about city money?
City money, and I would assume the bond money would need to be expended on a 55-year commitment level.
Okay. That, yeah, I mean, it seems like a logical thing to explore, right? And I wasn't involved in the drafting of Measure A. There were much smarter people doing that, but I don't know. That seems like a logical sort of thing that people would, try to make work. So thank you. The other question I had for you is, Jackie and probably Ray, is this. Oftentimes, and there's some of my residents here, and I get this question often, the question I want to ask you is, or let me make my statement first. The statement is this, that District 2, South San Jose, residential areas, right, not downtown, are taking the brunt of homelessness, of blight, and so I understand the perception. I drive down the same street, especially down Monterey Road, but I was wondering if you can help me and the residents and folks on the council understand which districts are doing, their good share of supporting some of the things we're talking about.
Yeah, thank you, Councilmember. So I would say homelessness impacts every district in the city of San Jose and in our region. There's 4,000 people, over 4,000 people on the streets in any given night. That being said, District 3, the downtown area, and District 7 are the two most disproportionately impacted by homelessness. They're by far the most number of homeless people living there, largely because we have the major waterways, Coyote Creek and Guadalupe River, running through those districts. District 6 has a number of people as well, but that's definitely where we see the concentration of homelessness in our community, and by far and away, District 3 has the most supportive housing and the most shelter beds out of all of the council districts, followed by District 7. We tend to see less services, affordable housing on the fringe districts in 2 and 8 and 4 at the edges of our city, and we see fewer homeless people in a lot of those communities as well. But along any waterway, along any major highway in San Jose, you'll see encampments, you'll see people living outside.
So can I just extract from that District 2 is not being overly saturated with a lot of what the city's trying to do with regard to homelessness and housing and all that?
Yes, Councilmember, District 2 has not provided significant housing.
And I asked that, thank you, Ray. I asked that because I think it's important to get an objective perspective. This is not, I've often shared that, but sometimes it's not believed. And so I thought it was very important to ask that publicly for anyone that's watching. Pull up the transcript. You can hear it directly from someone else. So that's all for my questions. Thank you very much. I just wanted to share a few comments. I haven't been on the council very long, but obviously it doesn't take rocket science to understand that this is a very complicated issue. I think for all the community members here, I mean, these are, as I've shared in community meetings, these are broad societal issues that we're grappling with, not necessarily of the making of the city or the county, but broader sort of challenges that we as a society face. And Scott Neese, I think, said it well. I don't know if he's here anymore, but really that term, it takes a village. And I really do think that this is one of those issues where it really does take a village, right? It takes the brains of folks at the county, the money from folks at the county, folks from the city, and ourselves, understanding the issues and making what we think are good decisions. But it also takes the community. It takes the community to be open to finding solutions. And with some of the comments that I've heard over the last few months of having contentious meetings, the one at the Hayes Mansion, whether it be the warming center meeting that we had just recently, there are some very good questions and rational, understandable concerns that residents have, and I have some of them as well. The questions related to the HEPA and things of that nature. I have children. I live in the district. But what for me seems a little irrational seems to be some folks' thoughts that, Yes, it's an issue. It's something we need to solve, but not here, not ever. And so for me, that is just a non-starter. For me, I'm interested in having a dialogue with both residents, experts, to really try to find solutions to this. This is not easy. I think what you see up here and what you'll see in council meetings when we discuss these issues is a real life grappling of what some of these issues are and how to solve them. These are not easy things to solve. And so for the public, if you're listening, if you're going to pull up this transcript, if you're here, the solution for me, I don't have the solution. I think we're all, as you can tell, struggling to find the solution. But what I do know the solution is not is being against everything, being against warming centers, being against housing, being against bridge housing. That doesn't get us anywhere. That doesn't get us anywhere. And there was a comment also made that, and I think certainly, I'll say very openly, I think it was made towards me, this perception that if I'm not doing what the room of angry people want me to do, then I'm not listening. I just don't buy into that. I don't buy into that. I don't make decisions based on people yelling at me. I don't make those type of decisions. I take information from the very diverse 100,000 or so residents that I represent, not just the 700 people in the Hayes Mansion. I take information that is presented by the experts here, and we try to make informed decisions. I am not against my residents. I represent my residents, and I think I do a good job of that. Now, we don't always agree, but I think that's just the way things sort of work. And so the very last thing I want to say is, you know, I've sat on many meetings in the 10 months that I've been here, and oftentimes when we talk about this topic, you often hear people say, I'm not against homelessness, I'm not against housing, I'm not against giving rental protections to people, but, you get the infamous but, the but. And for me, you know, I've been accused of being soft, I've been accused of caring about people, and so I think when people give that but, they want to express that they're compassionate, but. And so one thing I know to be true, and I heard this at a service at the very Southside Community Center that's going to be a warming center. This pastor said this recently, and I'm going to use his term. He said, compassion without action is nothing. And so our goal is to be compassionate, making intelligent decisions, and putting things into action. Sometimes people aren't going to agree with it, but it's something we need to do, and I'm never going to shy away from trying to make the best decision possible for all residents in San Jose and not a specific neighborhood. Thank you.
Thank you, Councilmember Jimenez. I'm going to ask Councilmember Rocha.
Thank you, Vice Mayor, and thank you, staff, for the presentation, and for those who showed up and provided some good input. I don't really have any comments. It's just more questions around the presentation, and oftentimes we do these study sessions, and from the manager's side or from staff side, they're looking for some guidance. Are we on the right path? What do you folks think? Do you have any other suggestions? Or here's an update, just wanted to fill you in. And I'm trying to grasp exactly what this one is, and it seems to me more just of an update, and that's really the end of it. There's really no opportunity for us to provide any feedback or additional direction or suggestions, unless we just want to go off the cuff about things. So can you help me?
Sure. So one of it was to provide some overall education on the regional approach, because we often come to council and talk about very specific developments and our very specific approach. But because all of our work is really done in collaboration with the county, we thought it would be helpful to have the county here to kind of make the connection between the work that we're doing in the city and how it feeds into this overall process and regional response to homelessness. And we'd actually never done that before because Key's office, frankly, is fairly new, and these systems have been developing over the last 3 years. So we wanted to, one, provide you with that overview and to just allow you to see how we're working collaboratively with the county. We did feel like the places where we talked about the challenges and the opportunities is definitely some place we're wanting to hear. If you agree with those places that we've identified as opportunities and challenges, or if you feel like we've missed places that we should be focusing on.
Thank you. And, and again, I'll speak to oftentimes we get these presentations a lot earlier than 11 a.m. be the day of the meeting at 1:30, so the ability for me to really give you thoughtful feedback is pretty limited, as you can imagine. Hypothetically, I might have had a meeting already set up and a lunch set up. So now I've got 15 minutes to read this, and if you're looking for me to give you any feedback on these slides, it's a bit difficult. I'm looking at the challenges that you talked to, and one of the slides just shows impacts of homelessness, a picture, response strategy, education redirection, another picture, environmental impact, response strategy, health and human impact, and another one that talks about response strategy, and a couple bullets, and then pictures of encampment. So I don't know what it is that you're looking from me. I'm quite happy taking this as an informational, but I guess I'm just left with, I don't know I can give you any value on this particular study session. We took time off on a Friday, and we've been here for 3 hours, and it seems more to me that this could have been more of an informational. I see the front end where we talk about the partnerships, but again, it seems like a lot of background. I guess, let me stop there, and I'm sorry. As you know, I'm very interested in this issue. I've been very committed to this issue. I've been very loud on this issue. I participated in the county housing task force, and I'm very passionate about this. But I was also looking for some opportunity for us to give some direction on some of the work we're doing. And whether it's, my notes are some of the stuff that we're working on, and in terms of updates, whether it's Evans Lanes, Plaza, safe parking, sanctioned encampments, drop-in centers, tiny homes. And these are just my own personal notes off the top of my head. Encampment sweeps, the Winter Faith Collaborative, the motel hotel conversions, all these items that I wouldn't mind an update on, but also giving some feedback in terms of this large amount of work that you folks are doing, and maybe giving you some direction on how can you work on this whole work scope, and then we have a 15-point plan from the mayor and how that fits in, and none of that is on this presentation. It's a lot of background, and then I'm still kind of left with, why, if it's just mostly background, are we getting a presentation 11 a.m. the day of a meeting? So there's my thoughts. So thank you.
Thank you, Councilmember Camas.
Thank you, staff, and Jackie. What are we planning on? How do you work with the police department? I heard a lot about roundups today, and I know you have a very dedicated department. And do you have a system? Do you have a cooperation plan with the police department so that we handle these folks in a respectful manner?
So, Councilmember, we do work very closely with our partners at police. Typically, we work with the division commanders, the captains for each of the districts, to have a coordinated response when they're encountering homeless individuals on the streets in need of street outreach. So we try and pair our street outreach teams to be available to police officers whenever possible. We also utilize secondary employment unit pretty extensively. The secondary employment unit works with the encampment response team out in the field, and a crew regularly follows the team to provide support and security for the staff, making sure that the work being done is done in a safe and secure manner. So
you have a plan with them then?
Yeah, there's considerable work. There can always be more partnership, and we're always, especially with the downtown captain, we're trying to see how else we can provide support and how else we can enhance the type of work that we do. So looking to the county mental health department, to their behavioral health, and seeing how we can bring in mobile crisis response managers to work with PD, and looking at pilots like that. So there are ongoing meetings and conversations about that.
Thank you, Ray. I know you've done a lot of work with this, and I really respect all your efforts. Do you, when we address these folks, when we come out to meet with them, do we ever ask where they're from? And I ask you this not because I'm saying that we don't generate our own homeless issues, but I want these people to be in touch with their families. A lot of times, the family support system, when it gets cut off, homelessness ensues and things go downhill in people's lives. Do we ask where they're from? Do we try to connect them back to a social structure that they are no longer missing or no longer having?
So, Councilmember, during the homeless census and survey, that we conduct every 2 years. One of the primary questions that we ask in the survey portion is where were you living when you became homeless?
I'm not talking about the surveys. I'm talking about when you actually go to these, for lack of better words, the roundups or when you go out to help these folks, right? Get off the streets. Are you asking them where they are from?
So when the encampment abatement teams are there, they're mainly there to clear the site, remove property, debris, materials, and to act on the trespassing order. But prior to that, outreach teams that we have out are always trying to pursue strategies, and whether that's family reunification or getting someone into the system of care, that's work that's always going on. So if someone has a safe place that they could go that's in another community where they're going to be with a family member, somebody who is waiting there to receive them and to provide them with a home, our case management teams and county partners are always looking to pursue that strategy if it's available, because it could be the most stable option that they have.
So we are asking them where they used to live before? Okay. Wonderful. Thank you. Thank you very much. This is an incredible issue, difficult to deal with, and I'm really happy that the county is here. And during Councilmember Morales' discussion, we brought up the 1,330 permanent supporting housing units that are available, but you said that they're not filled to capacity by about 400. Okay. And if you could, can anybody bring up slide number 46? Even if you counted every single unit that's in the supportive pipeline, we're not going to we're going to have 600 more units on board. And if 400 are available and not being used, I think that is our lowest hanging fruit. I think we need to get things going immediately with hiring, scour the earth. I mean, to me, it's like unfathomable that we'd have 400 beds not being utilized while we're trying to construct 613.
So just a clarification, I think when I was mentioning this to Councilman Morales, that represents our budgeted capacity to enroll and provide some type of subsidy or a unit to a chronically homeless person or a household. Most of that capacity is reliant on tenant-based rental assistance. Like, we have subsidies, we need to go find units. So it is unfortunate that we haven't enrolled enough individuals, but you shouldn't see that gap as actual vacant housing units.
How am I supposed to see it then?
Well, you should see it as individuals that we need to hire, and then they need to enroll people in the program.
Then I'm confused. What's the 1,330 permanent supporting? You said you have the capacity for 1,330. You're not saying those are not beds.
Those are not housing units.
No. Okay, so what are they?
So that is case management services, rental subsidies, mental health services.
So they're not beds.
They're not beds.
Okay. Then now I understand a little bit better. How much of this 1,330 is capacity, is beds?
I think I mentioned that less than about 10 or 15% of our permanent supportive housing capacity is actual housing units. Hence the need to develop housing set aside for this population.
Okay. So, you mentioned in the mayor's, can you go back to that slide 46? You mentioned in the mayor's comments about Laura's Law that your committee doesn't want to do it, basically, is what you said in a nice way. How do we deal then with violent, mentally ill people? Are we just putting them in jail? And if so, in the new jail that you all are building, are you building capacity to house mentally violent criminals in the new jail that you're contemplating?
I will say that the one focus of the board has been to divert or provide the necessary supportive services for people with a mental illness so that they're not inappropriately or unnecessarily utilizing the jail. There are, I think at any given time, I think there was like several hundred individuals with a serious mental illness in our jail system. And for most of those individuals, permanent supportive housing is a proven effective strategy. The committee declined to advance recommendations regarding AOT. However, they have been focusing on implementing additional services, and as Ray mentioned, our behavioral health director has been in conversations with your police department and other police departments to implement our mobile crisis teams, and that's about, once fully staffed, would be about 4 mobile crisis teams countywide, operating 7 days a week, about 12 hours a day.
You'll have to forgive me, but I'm really not sold on this solution. I think that it is the county's purview to take care of the violently mentally ill. And if you walk down Santa Clara Street, I hope you do, walk down Santa Clara Street and tell me tell me if you think that the county's doing a good enough job taking care of the mentally ill that cannot take care of themselves. Another thing that I have on this screen here, it's glaring to me, and I hope it's glaring to some of the folks in the audience who have been advocates for our homeless community. Take a look at Campbell, Cupertino, Los Altos Hills, Los Gatos, Montserrino, Milpitas, Saratoga. What are they going to be doing? And I'm assuming unincorporated means Santa Clara County, correct?
Correct.
Okay, so even Santa Clara County doesn't have supporting housing units on the pipeline. How are we, here we have the city of San Jose, which is half the population of the city, but is doing 544 versus everybody else doing 213. How are we going to ever catch up if nobody else wants to participate in helping? Are we having discussions with the rest of the cities in the county? Why can't Campbell put in 6 like Los Gatos did?
I don't think I have an answer for you there, but I do want to make a clarification or else Campbell will be angry with me. I made a mistake that Los Gatos is in Campbell, so I just want to say that for the record. But I think I share your pride. The city of San Jose is doing a great job, and we want to do more in there, and we want to work with our other cities and in the unincorporated county to build more supportive housing.
Thank you.
Councilmember Davis.
Thank you, Vice Mayor. First of all, thank you all. This has been a ton of information, and I really appreciate you putting it together for us in such a concise format. Your presentation was an hour, and I learned so much, so thank you all. We heard some concerns from the community about the Housing First strategy, and I think Ray or Jackie, one of you wants to talk about what does the data tell us about this strategy versus other models of addressing the issue of homelessness?
Yeah, council member. So I would say that the data is saying that Housing First works in a very significant way in terms of housing retention and in terms of the reduction of harm to people once they get into housing and the services that can be provided to them. I could let Key talk more about the data from Project Welcome Home, which is a Housing First model. But more than anything, Housing First is about removing barriers and getting people into homes. What we don't have right now are the homes to get people into, and permanent homes too, places where they can stay for the rest of their lives. So Housing First works. It's adopted nationally. It's working in communities from Houston to Salt Lake City, to New York City, to California, to LA. So it's working everywhere. We've got a lot of data showing that over 85% of the people that are in programs and in Housing First supportive housing programs or rapid rehousing programs are staying housed, and they're improving their health, wellness and income indicators. So we see a lot of success with it.
Thank you. Do you know what how it affects the safety of the community, the overall community, by any chance?
Well, I mean, I think the most dangerous conditions that we have for our community as a whole is when people are living in unsafe and unstable conditions and are on the streets. People living in encampments or on the streets can be victims of crime. There can be issues with health outbreaks. There can be fires. There can be all number of things. If you get people into housing and you restore creeks to their natural environment, you get people off the roadways and off the interstates and you get them inside, that definitely reduces the burdens that we're seeing in terms of impacts of crime and impacts of health and safety indicators. Well-run, well-maintained, well-operated, affordable and supportive housing in our communities is an asset. It's quite simply an asset, and I think we're seeing that with lots of the stuff that we have here and programs that are going to be coming forward soon.
Thank you. I think it would also probably reduce the stress on police patrols as well, I think. So we looked at a lot of data today, and I one of the things we didn't talk about, and I know it's probably because you packed a lot of information in the hour, is benchmarking our outcomes. Do we have a plan for that? Do we do that already? And what are our benchmarks? What are our goals for retention rates and success rates and all of that kind of stuff?
We do have that, and we can provide that. For example, in our permanent supportive housing programs, the housing retention rate goal is 80%, and we're at 84%. But we have a whole set of benchmarks and performance standards for all the different housing program types, and we can provide that to Jackie and her team and to provide to you.
And do we benchmark against other cities? How are we doing in relation to other cities that are addressing this problem, similar to the way we're addressing it?
Usually when we set those goals, they are a little bit of what kind of HUD recommends, because a lot of this is driven by HUD, a little bit of what we've done locally, and then increasing those goals over time. If the council was interested in seeing how we compare to other communities or continuums of care, we can try to work on that.
Okay, thank you. I think it's just helpful to know, if we're always wanting to look at best practices, right? And if there are other cities, it's great that we have these goals and we're exceeding the goals that we have. But if we benchmark against other cities and we find that they're doing better than us, then that gives us a sense of, well, maybe there are best practices that we could look at to do things a little bit differently and improve our outcomes even more. That was kind of where I was coming with that. And kind of in that vein, I think, was it Karen Gillette or someone from the network that was talking about best practices for emergency services? Could you talk a little bit more about that? We talked a lot about, in the formal presentation, there was a lot of talk about what we're doing with permanent supportive housing, but I know that a lot of the comments were about emergency services and what we need in that respect. Can you talk a little bit about kind of what's happening in Santa Rosa and other places?
Yes, thank you. Yes, there are some things that the city of Santa Rosa has proposed, as you'll see if you look in that their proposal for support to homeless. There are very low cost support that can be given, the portable toilets that they suggest, storage for personal belongings, and certainly they're looking at garbage collection, sanitation centers, mail collection. I think, all of these things, if we would think for ourselves, what would we need, to start to stabilize. And these are things that are very low cost that could be done aside from, spending the money and the time to build homes, to build even temporary housing for people. Certainly the community drop-in centers for teens, is something, a community center is something that I think we could, get up pretty quickly either for teens or for the older homeless too, that doesn't take time to look for sites and the money to build and all of that. So those are some ideas from some of the other municipalities.
Thank you. I really appreciate that. So for Ray, kind of to piggyback on that, in terms of the kind of the safety of belongings and the sanitation issues that Karen brought up, is that something that we could address in a quick way, do you think?
So actually, we're going to be bringing back, when we come back with bridge communities and encampments for that piece of work, what we've been trying to do is include a broad range of different strategies that we can be doing in the short term for council consideration.
I appreciate that. Thank you. So just because a lot of people have talked about the fact that winter is coming up, I want to put a plug in for my colleagues, as we've talked before about the Winter Faith Collaborative and Village House, and my commitment to have another one of the churches in my district participate, and I hope that you will all also be doing that. They are church-based shelters and daytime warming centers. We have a number in my district, and I'm having a little luncheon with the faith leaders in early November to ask for their participation. And the churches in your district don't need to participate by actually hosting necessarily a warming center or a shelter, but they can participate by providing not only funds, but volunteers for the other participating churches. So just something to keep in mind as you're doing your newsletters for the next month.
Thank you, Councilmember Davis. Councilmember Nguyen.
Thank you, Vice Mayor. First of all, I really appreciate this study session. I would like to welcome Katherine, Harass, back there. We appreciate it. Good meeting with you, and thank you for your help. Thank you, Ms. Keeley and everybody. Especially I want to recognize the folks from the Luis Valdez Academy, Wendy Seven, and a lot of advocates. And thank you for your time. Thank you for your engagement. I appreciate it a lot. Thank you for coming. This is a student from the Luis Valdez Academy, and I really thank you for your engagement. Thank you. I would like to see you later. Folks, one thing, I must respectfully disagree with the comment that one of my colleagues said about the issue. He said it's complicated. Well, certainly, I disagree in the senses. The issue says it's not complicated. We made it complicated. We made it complicated. It took me a year and a half to convince staff that, hey, we can have alternatives instead of permanent housing. For example, today I'm a bit surprised that we can welcome the folks from the county. I appreciate that a lot. I would love to work with you more. In fact, I would love to see more of this together. In fact, I would suggest, let me tell you why. I've learned, we have confirmed many times, it costs the county $500 million a year on the homeless services, right? And if that costs, why don't we declare a crisis, make it a top priority, and put each one of us that I volunteer on a weekly basis, get our action to it right away. Sit on it, do something. For example, I've been begging Ray and Jack for you, but we've been looking for location, for site, for alternative housing, from safe parking, from tiny home, for example. We had a list of 100, and we scaled out to 2 now. And we wish we had more cooperation from the county, because there are lots of lands for the county. So again, this is a big topic, but from my point of view, if you really want to accept the fact that it is very, very bad, it's a crisis now, and we put our energy, our mind, our heart into it, and really prioritize, we can make it work. So I would suggest, again, there's a lot of work to be done. First of all, I want to thank you. At least we are addressing it. And is it one of the rare times we have a study session? I would like to see more. I would like to be working with you, supporting you, and to see whether, but to simplify the matter, I really would like that we don't stop the conversation right now. I would like to, after this, to see county and city actually work together on a regular basis. If not monthly, then weekly. And I would like to be part of it. And at least on the issue of identifying the site from the county land. And let me tell you why one of the things that I counted, I tabulated all the numbers that raised slide show on the numbers of the housing and where the numbers were I got. And it's only all the location we look at your slide, Ray, and the total tabulation is 735 units, 735 rooms, right? And that's spread out for another 3 years or so. Even that, and we're sitting here telling good story, that's our solution. I don't think we see a solution, because by that time, and with that, the rate of increase, we will have more before we catch up. So on one hand, I agree with staff that, hey, it's only the final good solution will be permanent housing. The reality is, it is more like winning a lottery ticket, which is down. The reality is we face with the situation on the street, especially in my district, a lot, every day. So, at least on my part, on District 7, we do a lot of cleanup, trash. So I appreciate one of, Deb Kremers, I think, she made a good point of, I hope that the advocates and the homeless people would understand the frustration people try to help them, so they could cooperate by not mounting on more trash than necessary, or not dumping more trash or food there where they could be served elsewhere. So the bottom line is, I think we just started the conversation. And from the presentation, I find it the solution not adequate given the situation. So I really would like to see an urgent action that actually engage both the county and the city. So with that, let me ask just one question: that do we have a task force or something similar in nature that really promote the cooperation, both the county and city together, to really work on this issue on a more regular basis?
So we are working with Council Member Morales with his idea regarding having a city and county-wide kickoff for some sort of task force, and his idea is to see if there's really interest among all the different interest groups. So that is something that the department is working with Councilmember Morales.
Thank you. I'm so glad to hear. What about the? I would like to invite Keely to respond. Well, what about the notion of identify the site, the county site, county land? You know what we're talking about? You know.
Sure. In the report that we provided to our committee yesterday, we said that we would begin to look at the potential county sites that could be used for temporary housing. But what we suggested was that we would bring forward recommendations only when we felt that we had the support of the community in order to make that siting and that program feasible.
Thank you for your answer, and that educate me and confirm my concern a lot. I've been here almost three years, and your response that you will look at. So we haven't looked at for the past 5 or 10 years or so, and you won't show the release. I'm looking for years. I would love to see the report, and may I suggest that I would ask for a meeting with your folks and with our city staff to see whether I can work with you on finding a possible solution. I understand totally that the notion of having community support is great, But I think one of the reasons why we have some pushback is the location, the site that be too close to residents. Meanwhile, we have, the reason I ask is because county has a lot of a little bit better suited locations other than the city. And I thought that would be great help. So I want to close my here, but I really look forward. So can you promise me we can contact hook up? I mean, I would love to continue the conversation offline, and would love to join any task force you might have to see whether we can work together. And I'm available on a weekly basis because I think this is very urgent. Is that okay? Is that a yes? Thank you very much. I appreciate it.
Thank you, Councilmember. Councilmember Diep.
Yes, thank you, Vice Mayor. I'm the only thing keeping us from going home, so I'll be really brief. I thank you for the presentation by the various entities here today, and Supervisor Cortese and I will be holding a kind of a community meeting on homelessness on October 26th at the Branson Community Center. I know Ray is going. I'm not sure if Key is going to be there, but if we can distill some of these talking points down and maybe make that part of the community presentation, I think that would be helpful. But my ultimate question is, after the whole tiny home incident in recent months, and I've heard an earful from my constituents, the issue of homelessness has kind of climbed on my interest, my topics of interest, just kind of as a council member. And when I went to Seattle, I actually went out of my way and I visited a tiny home site up in Seattle, one of the ones they have up there. And it wasn't half an acre. It was, I think a 20,000-foot lot, and there were, I forget the numbers, but the people there seemed happy, and they welcomed me in. They gave me a tour. They showed me their facilities. There were children living there. The social services allowed one woman to bring her one-year-old back to that place. And so it seemed like a workable model to me. And then a week later, I went to something in Orange County, and along the Santa Ana River Trail right near Angel Stadium, there's this 6-mile encampment where people are just, drawn out along the trail. And I walked that trail, and I tried to talk to folks, and I actually met some advocates who were trying to warn the homeless about a potential police raid. And the people who lived there just didn't want to talk to us. They didn't care. They didn't, even though we were trying to offer information and help, they just didn't want to engage. And so the thing in my mind is, how we do the tiny homes or the encampments or whatever, but the issue for me is quality of life. And then I ended up talking to a sheriff down there, and he peppered me with questions, and we got into a little discussion. And my takeaway is from that discussion, what do you do with people who don't want to be helped? So just broader pictures, assume we have all the funding and assume we have everything to do to attain all the goals that we're trying to attain. But in the larger picture, there's always going to be this segment of people who just want to be free, or who just want to live, outside society, let's say. Does that mean that as city leaders, we need to start thinking about designating like a Skid Row or an area where people can just kind of do something, or what? I'm just trying to grapple with this broader notion.
Council member, I'll tell you, in my experience, working in the field of homelessness for a long time now, I'd say that on a rainy night when it's 38 degrees, nobody wants to be sleeping outside. I do believe, though, that there are a tailored set of approaches, and it's not a one-size-fits-all. So the folks that are most resistant to coming inside either have a history of mental health illness, they've been victims themselves, the system has failed them. There's a complex set of challenges that they're dealing with in their life. So I think if you can work on those challenges and have the right-sized approach for the person, I think you'll have tremendous success in getting almost everyone in. It might take a lot more work with some people, but those hardest to house are probably the people most in need of help too.
All right, thank you. That's insightful. I look forward to having more offline discussions on that. Thanks, Ray.
I think that's it. Any other comments from my colleagues? Did you have a closing statement, Jackie?
Yes, thank you. So
Okay,
again,
thank
thank you all for participating, and thank you to the audience and all the people who did come to speak and share their experiences. Really, the purpose, again, of the study session was to provide council with a system-wide level overview of our coordinated regional response. And I'm hoping now that you have a better understanding of that regional response and our cooperation with the county in order to deliver services and to measure those outcomes. The information on the challenges is really to give you a preview of some of the action items that you will be seeing in the next 6 months. So, for example, we will be coming back with a new agreement with the Water District regarding our abatement program. We are working on the feeding program. As you've seen, we wanted to make sure that you were all aware of it, not just the 2 council members who are aware of the program. And of course, you know, the big item which we're coming back with, which is bridge communities, looking at encampments, and then looking at those shorter term solutions. We understand that it has to be part of our work plan, and that is something that we want to get more feedback from you, or direct feedback and direction upon our return. So again, thank you.
Thank you, Jackie. And I just wanted to say, I wanted to thank staff for your presentation. And I know that when I first took office, this continues to be an overwhelming issue that we're dealing with as the city of San Jose. And I want to thank, of course, all of those that came and spoke, and especially those who gave testimony as to what they were experiencing, especially Ms. Frenchie. I know that she's gone, but it takes a very brave person to be able to come up here and to be able to share such intimate details about their lives in order to be able to move a very aggressive agenda on her behalf and on behalf of those who are really having a very difficult time in our city. So I want to thank everybody for being here. And with that, our study session is adjourned. Thank you.